who help us make sense of the medical journey, and most importantly, we remind each other that no one is alone.
So the first thing you have to notice about something like vitiligo is that the social impact is huge. And therefore, if you don't provide any psychosocial support, you...
Wapi makofi yao pale? Thank you so much. Prayer, recycling. That's a good job you guys are doing. Tunasema ni hongera sana kwenu. So right about now, ladies and gentlemen, we want to switch to the panel session. Okay. I think we still have one more booth, yeah? Okay, sawa. So kindly just come through. Mtu mmoja a volunteer akuje tu for, yes. As she make way, we are finishing up with the vendors, the partners, then we get to the panel session. A very interactive panel session. Remember, we're all about learning today and creating awareness. Karibu.
Hi guys, my name is Wangeshi, and I'm a vendor and also let's call it a caretaker. I make beaded bags, and I'd like to invite any warrior who would like to learn. I'm willing to teach you for free so that you can also make some money while you create beautiful things. I also am selling jewelry and makeup brushes and makeup, so karibuni sana.
Lazima watu wakaipoa, au sio? Urembo gharama, lakini leo unapewa kwa urahisi, au sio? Haya basi, I think we have a last. Karibuni. Waitwa Hope Mode, eh? Tuambie.
Good afternoon, everyone. My name is Harold Tender. I'm a cancer warrior. I survived cancer 2 times. Through my milestones, I was able to come up with Hope Mode. This is my foundation to help spread cancer awareness and raise funds for the cancer patients, because I've been there as well. In every match that we sell, it goes back into raising funds for cancer patients. And recently, I came to know about the Lupus community, and I'm glad to join in. So in every match usually has a message on the back, which says hope is eternal, just to show you that we can do it. Hope is eternal and hope is alive. Is my friend Guyo, as you can see, he's holding some of the match. And you can find us in any platforms, Instagram, Facebook. Feel free to reach out to me. You can have my number. You can have my match. Let's talk about it. I know how it feels to be on the other side, and the battle is for all of us. So feel free to contact me. Hope Mode, hope is a channel. Hope Mode on, yeah. Switch your Hope Mode on.
Asante sana. Wonderful. Remember, today is all about warriors, how see? So it's very, very encouraging to see that we have warriors who are doing well for themselves and for the community pia. So right about now, Mr. Mickey, tuko vipi? Hapo sawa. So we want to get to a very engaging session here. As we get to celebrate Purple Parade today and the World Lupus Day, without a doubt, you cannot have this moment without having our warriors talk to us, talk about their lived experience. And right about now, we want to get into the lived experience panel. It will be moderated by one Esther, so I'll of course hand it over to her. But first of all, for this interactive session as well, I would kindly ask for us to pay attention, because we're walking this journey with our warriors, our caregivers as well. And for the partners, tunasema ni asante. So it will be so much important to get something from our warriors today. How's here? Ladies and gentlemen, do remember that behind every diagnosis, there is a deeply human story. That is why it is very important that we have this session. Hi, Abasi. So this session that we're about to have right now is a space for sharing the courage, lived experiences, resilience, and hope of Lupus warriors. I'd just like to mention whom we have. We do have a male warrior with us this afternoon on this particular session. His name is Steve. He is a male warrior. We also do have a Dorcas with us. Dorcas is a female warrior as well. We do have Soyan in this particular session. Soyan has been a warrior since below the age of 18. And we do have a caregiver, Mama Natasha, who will also be sharing her side of the story. So thank you so much for coming up and talking to us about this amazing, amazing day.
Hello, everyone. Habari zenu? You're good? Yes. Karibu sana to this wonderful and very important session where we will have a conversation with our warriors. First of all, I'll introduce myself. My name is Esther Ashira, and I host a show on YouTube called Behind the Diagnosis. I have interacted with quite a number of warriors here and also doctors. We create awareness on rare and autoimmune conditions. We've covered quite a number of conditions. You can find us and follow us on 3K Media TV. You'll see very familiar faces there, and you can get to hear some of the stories we've shared and the upcoming stories, and these ones being the latest one. So I'll start just next to me to hear a brief introduction so that we can also know who you are before we get deeper.
Okay. Good afternoon, everyone. My name is Caroline Maimu. I'm from Tanzania. I live in Dar es Salaam, and I work for Farmer's Choice in Dar es Salaam as a sales manager. I'm the mother of a lupus warrior, Natasha Muloko, who was diagnosed since I think around 2007. So I've come here today to definitely support her and the rest of the warriors.
Hi everyone, my name is Dorcas Malay. I'm a 6-time warrior. I have 6 conditions. I have SLE, lupus, rheumatoid arthritis, steroid-induced diabetes, hypertension, fibromyalgia, and Reynolds syndrome.
Good afternoon. My name is Stephen Omondi, and I'm a warrior as well. And I was diagnosed with lupus around 2021, and I'm diagnosed with the SLE. So I'm here to share my story and also to know my journey as well.
Good afternoon, everyone. My name is Soyan Sheila. Myself, I don't have lupus, but I have 3 other autoimmune conditions. That's Reynolds syndrome, scleroderma, and rheumatoid arthritis since I was 11 years old. Thank you.
All right. To start us off, we'll start with Soyan. what you haven't mentioned is that you were diagnosed when you were very young. So I would like you to just tell us what is that one thing that people don't realize about growing up with a chronic disease.
Growing up with growing up with an autoimmune condition is quite a challenge because I was diagnosed when I was 11, and I was diagnosed when I was 11, and at that age I wasn't able to really describe to the doctor how I feel. So at first there was a lot of misdiagnosis here and there. I've been in and out of hospital, and at that age sometimes people think that I'm pretending because maybe I don't want to go to school or maybe I don't want to do something. But in real sense, the way they're calling it invisible disease, it really is invisible, because one time I'm out there playing and socializing with other kids and doing everything a kid can do, and the next morning I can't even move, I can't even get up to go to school. And before my mom knew that it was a serious condition, and the doctor who diagnosed it had to sit her down, she would beat me up. You know, for those, let me say, millennials mostly, if when you're growing up and you refuse to do something, your parent would whoop you, like atakutandika vizuri sana, because they think maybe you're pretending or you don't want to do it or you're just being a difficult kid. So growing up with an autoimmune condition was quite hard, because I'll tell my mom I'm feeling this, and she would look at me and say, kunywa maji moto, sugua na rob, and that story would go like that until that one time I had to change doctors, and the doctor who we were referred to had to do extra tests, and at that time the tests were coming all the way to Nairobi. My hometown is in Narok, so it was quite a challenge, but I'm grateful that eventually the test came out with rheumatoid arthritis, and here we are 24 years down the line.
Wow, this is just a follow-up question. How long was it between the time that you had the symptoms and the time that you get a diagnosis? Did it take long? Was it a big challenge, even for the family? Because you're saying you are a child and you could not even explain yourself well.
It took about 3 years because the real diagnosis came in when I was 13, and I was about to go to high school at that time. And we had to work with the doctor and the principal of a school close to my home so that I can still go to school and I can still get the treatment that I need. So the 3 years were a hassle. And coming from the Maasai community, they would see my joints swelling and they would say, "Uyo mekula nyama sana." Or they would assume it's, mostly they would assume it's brucellosis or something. And I've been treated for that severally until now when we changed the doctor and we had to go to a specialist, and that's when the real rheumatoid arthritis diagnosis came out.
Wow. I would like to hear from a caregiver because of her experience. I don't know if that was something close to you. For Natasha, was she diagnosed? Was she small? How did you get to know, and how did the journey even begin for you?
With Natasha, actually, her symptoms were more or less like she had leukemia. So when it became serious, because they were doing all sorts of tests, but they didn't know what she's suffering from. Sometimes they're telling her, oh, you have malaria. Or sometimes you have UTI. You know, so finally when it became serious, we admitted her at the Aga Khan hospital. And it actually took a month before they diagnosed her with the SLE lupus. And this was now doctors from all hospitals, the Nairobi Hospital, Mata, everybody was there surrounding her. And they finally decided to do a test of the lupus and sent it to Germany, and that's how now they found out she had lupus. And it was such a good thing, you know, immediately they knew what she was, her illness was. 2 days later, she was discharged from hospital because she just took the medicines and they started working. She could walk, she could do everything.
Wow.
Yeah, so she just came out with a box full of dawas.
Was that a relief for you?
It was a relief because for 1 month, a child is in hospital. You don't know what they're suffering from. Nobody can tell you. Even the most senior doctors could not tell what she's suffering from. So the minute they did the tests and they found out this is lupus, and they gave her the right medication, 2 days later, she was discharged from Aga Khan hospital. Yeah.
Had you ever heard of lupus before, or was that the first time?
I did hear of lupus through Lona Irungu, the late. Yes, that's how we started now finding out about. So when Natasha was diagnosed with lupus, everybody was like, that disease of Lona Irungu, you know. So a little bit we related, but we didn't take it so serious because she looked so well. Like you said, you know, you look so well, nobody can tell you're ill. So we were wondering, what is this lupus? And Lona Irungu looks so well, she's working. Yeah, exactly, yeah.
Oh, wow. I'll get to Dorcas. You mentioned quite a number. I don't know what came first and how did your journey begin?
I can say I was always a sickly kid, and unlike Soyan or even Natasha, unfortunately, I was not diagnosed when I was a child. So it was always misdiagnosis after misdiagnosis. At one time, I was actually even taken to the mental side because the doctors used to say it's all in my head. So it was always like that. So when I fall ill, instead of being taken to the right doctors, I would be taken to a child psychologist because they thought there's something inside, like I'm making myself sick. And then later on, my biggest flare-up came in 2013. So I just struggled going to hospital, sometimes being taken to Mathare because they thought it is in my head. And then in 2013, that's when I got my biggest flare-up, whereby I couldn't walk. I kind of just became paralyzed and I couldn't speak. So I lost my speech, I lost my mobility. That's when now we started the journey to finding my diagnosis. And it was not found immediately. It took 2 years, from 2013 to 2015. That's when now I thank God for the late Professor Kioi. He's the one who diagnosed me and referred me to my primary doctor right now. So when I went there, that's when I was found I had lupus. And it was, at that moment, it was just lupus. So I stayed a few more years, 2013 to 2018, still lupus. But now in 2018, then I went back during our run, the various tests and all that. That's when I got that new diagnosis of RA. So now I was dealing with lupus and rheumatoid arthritis in 2018. So from 2018 to 2020, I was still sick. And then I was on a very high dosage of steroids. So that led to one of the side effects of long usage of of steroids is you can get diabetes. So unfortunately for me, then I got the steroid-induced diabetes, and then diabetes normally comes with hypertension. So those ones, they don't. They're like sisters. They're twins. Exactly, they're twins. So if you get a whatever for diabetes, a diagnosis for diabetes, hypertension has to be there also. And then again, I fell. So I had to take a break because now I was really working. I had already changed careers, so whatever I was doing now had to take a break. And then now in 2025, then I felt really ill, admitted in hospital. That's when now I got my new diagnosis of 2 more, fibromyalgia and Raynaud's syndrome. Yeah.
What did that do to you? You have 1, you have 2, and then 3, and then you also told that you have the 5th and the 6th one.
It takes a toll. It really took a toll on me at first because, you know, like whenever, especially, I don't know if my other warriors can relate with me. So when you go to a doctor, you always want to hear that you're progressing, you're doing better. But now when you go to the doctor and then you're told, oh, my friend, on top of that, we are adding you another one on top of that list. So you have to dig deep within yourself and just master strength. One thing I can say, I think it was a blessing in disguise because now, when I got my first diagnosis, I wasn't that young. I was 34. I was a bit mature, and in me, like, there's just that thing, like, you have to fight. And then thank God that I had a wonderful support group. And I can say, like she's mentioned, when I got my first my diagnosis of lupus, I looked up to Lorna because Lorna was a colleague. We were both in the media industry, so she was a colleague. So I just went and talked to her, and she encouraged me. And then I also met another warrior. I don't know if she's here. She's called Wendy. So they really held me up, and so I did not lose hope. I knew, you can actually do this. Yeah. So, but apart from the support system, it does take a toll. It does take a toll mentally. There are those occasions whereby you're like, now what's the essence of even living? Because each and every time, if I go to a doctor, it's a new thing. Yeah. So there's that thing at the back of the mind, even like you dread going to your appointments because, and then when you're sent to do the lab works, you're like, okay, what now? Yeah.
What's coming? Yeah. Wow. So in short, what you mean is a strong support is very important to any warrior.
Oh yes, it's a strong support system. If you have a strong support system, it like kind of the battle is won 80%. So you're just left with maybe like 20% on yourself to do the work.
Wow.
Yeah.
Wow. Steve, even from how we are seated here, you're the only man.
Yes.
Yeah, and it's very rare to hear that a man has an autoimmune disease. It's not that they're not there, but they are very rare. Even there's a speaker who said that earlier on. Was it believable for you when you told, I don't know if you have a friend or a relative that you have lupus? How was it? Even just getting to know that you have it from yourself. I don't know if you've ever heard of any man with lupus.
Okay, my journey started around 2021. I was in a burial. I lost my grandfather by then. So it started with numbness on my feet, and I couldn't wear my shoes properly. So what I did was just to dip my feet into the water so that maybe I could relieve myself by then. So I couldn't know what exactly was happening by that time. So after the burial, I came back. I work in Isiolo. I went back to Isiolo, and it got worse. I was taken to a certain hospital because the pain was so much intensive, like it was excruciating. So I was taken to a certain hospital, and just in Meru, they did an MRI, but they did what diagnosed me was was pulmonary tuberculosis. So they gave me certain medication to take for some time, but the situation was not that was not coming down. So what I did was to come. I was told to come to Nairobi to go to KNH, and that is where I stayed there for about. I was admitted for about 4 months, and the doctor there was Dr. Itau, and he was the one who diagnosed me after 4 months. So after diagnosis, I didn't know what exactly is lupus. So they taught me about lupus, and they told me this is an autoimmune disease, and this is what it entails. So you have to take your medication each and every single day, and these are some of the medication that you are supposed to take. So after that, I accept the situation and started moving on with life, and that's how I got here.
Wow. So when you told your family that you have lupus, what was the reaction?
Even them, they didn't know about the disease itself, because they were also caught unaware. So they were told with the doctors, this is the disease, and it's an autoimmune disease, and you guys, you have to take care of him. You have to make sure that he takes his medication each and every single day.
Wow. So Jan, what is that one misconception that many people have about autoimmune diseases that you would like them to know what the truth is?
As a rheumatoid arthritis warrior, I would say people think that arthritis ni ugonjwa ya wazee. Who even came up with that idea? Like, who said because you have joint pains, you are supposed to be, it's supposed to be ugonjwa ya wazee? That is one thing that I've been, up to now, I tell someone I have rheumatoid arthritis, they're like, hey, arthritis ni ugonjwa ya wazee. Me si mzee. Like, it's not about being mzee. It's an autoimmune condition that I got when I was way before I was even a teenager. So, even sometimes, even there was a time because of the medication I was pre-diabetic, and I tell someone I'm pre-diabetic, they're like, ugonjwa ya sukari si ni ya wazee. Whoever said because you have to be, because you are sick when ni mzee? Some wazees are even healthier than some of the youngsters. Yeah, but that one thing is before you can give your suggestion, try and learn about a certain condition. Yeah, some of this condition comes, some of these conditions we don't even know anything about them. So before someone can give a suggestion or an opinion, please try and learn about that certain condition. Yeah.
Wow. I would like to hear from Mama Natasha. Is there a point you've ever felt like, I am tired, I also need help as a caregiver? And whom did you turn to?
Okay, like I said before, I live in Tanzania. So for me, that was before now. When immediately she was diagnosed, I stayed with her and everything was smooth. So of course, with the side effects of medicines and all that, you find now like Natasha became a renal patient. That was very difficult, but luckily then I had not moved to Tanzania. So she didn't want to agree to do dialysis. So, and also me, I was like, why should my daughter do dialysis? This is a death sentence for her, you know. So kidogo, with the support of the families and friends, especially her friends, they've always been there for her. The people she called here to cut the cake with her, the G crew, those are her support team. Unfortunately, some of them have gone, But those are actually the people who should have been sitting here on this chair today, because they've gone with Natasha through thick and thin. The one time that really affected us was she actually got COVID, and she was admitted at the Nairobi hospital. So that's the time now I'd given up. Yeah. But she pulled through. She's a very strong girl. Yeah, she pulled through. She did all the tricks she can do in that ward to get out of there. You know, like how you're supposed to, they give her the oxygen, and then you shouldn't remove it so it can help you breathe. How she used to remove, when the doctor passes, she removes it, and she starts practicing how to breathe on her own. You know, yeah, she walks, she comes out of her bed, she walks around her bed. She's just walking, exercising, and doing all those things. Yeah, so, but God has seen us through.
Wow, she was determined.
Yes,
she was
determined.
Wow.
Yeah.
Dorcas, is there a point where you get confused when there's a flare?
Oh, yes. Sometimes, although it takes practice to know what you're flaring on, yeah, but in most cases, definitely, because sometimes the flare-ups are not that clear. Something like RA, I can easily tell now this one, because I'll feel like the joints are really inflamed and all that. But, and then sometimes, although like the joints can be inflamed, sometimes like you're wondering, is it RA or is it fibromyalgia? So, although like, I don't know if it'll make sense, but the pain levels, they differ slightly. So that's an indicator of what, of what you're flaring. But one thing I've learned is that when I'm flaring, I don't rely on guesswork. I just have to go and see my doctor, so that at least I can get the right treatment. Yeah.
So what you mean, a relationship with a doctor is very important.
Yeah, my primary doctor is like on speed dial.
Wow. Wow.
And I can say, like, I just thank God. I really appreciate God, because the doctor I started with, up to now, he's still the one. So even when I just call him and tell him, like, hey, listen, I'm here, like, I'm feeling like this, whatever time, he'll pick my call. And then he will guide me. So if I have to rush to the nearby hospital, because I actually live in the suburbs of Nairobi, and my doctor is based in Nairobi. So when I get there, I give if I am able, or if I'm with something, maybe a family member or something, they will give the phone to the doctor there, so that they can liaise with my doctor. So that helps a lot.
Wow. I would love to know what keeps you going.
Well, I think faith, lots of faith, lots of hope, and then self-determination and positive mindset, because I'm a believer of not letting the condition define you, but working around the condition. Just like Mama Natasha has said, the way she was practicing how to breathe and all that, you just have to find the zeal in you to fight and not lose hope. It's not easy. Sometimes, like, you can go to the deep, to the depths of maybe sometimes depression, but then again, you just have to find the will. And then also, when you're depressed, you also seek. I'm a believer of seeking therapy, because really therapy works. And for my case, with the multitude of conditions that I'm suffering, it's good. Like, I knew the essence of seeking professional help, seeing a therapist, taking you through, and then, yeah. But then again, like I say, apart from all that, also the support system. I am grateful enough, and I'm thankful enough, because I have a strong support system.
Wow.
Yeah.
Wow, that's wonderful. Steve, has it been, have you ever had pressure talking about lupus as a man?
Not really. Since I accepted the situation, I've always accepted the situation, and talking about it it has been freely.
Okay.
So there's nothing hard to talk about it, to encourage maybe other warriors to also to accept the situation, because though it is difficult to deal with it, but there's no other solution but to just accept the situation. Yeah.
So speaking out helps a
Yeah,
lot for you.
definitely.
Wow,
Yeah.
that's wonderful. So Jan, what would you want parents to know, especially having been diagnosed while you were young? And maybe you have encountered many people who have not been understood at that young age. What would you love them to know?
The first thing is, please try and listen to your kid. Because I had been trying to tell my mom, I'm not feeling okay, and I would end up being whooped because she thought maybe I'm just being lazy or I'm just trying to run away from chores or responsibilities that were given at home. Because she would leave and say, we fanya hivi, we osha vyombo, we osha nguo, we osha nyumba, and she would come back and the vyombos have not been washed. And maybe because at that time my knuckles are swollen, my joints are in pain, and I cannot even do anything with cold water. So I would urge parents with young warriors who are kids, if you could please listen and try talking to your kid often. Just listen to them. Akisema naumo na nywele, you believe them, please. Because as old as I am, I'm 35, but last year I told my mom naumo na nywele and ended up having alopecia. So akisema naumo na nywele, you believe naumo na nywele. Please listen to them.
Wow, that's a good one. I would like each one of us to just do our final remarks. What is one thing you love, either a caregiver, either a friend, to know about whatever condition it is that you have, as we finalize?
Caregivers, friends, families, these conditions do not define us. We are capable of doing some amazing things out there. So please give us a chance to try the best we can. And if we say we can't go beyond a certain limit, please let us go na pesi yetu. Yeah.
I can also say that as much as we are going through this difficult situation, we are capable of doing some other things as well. So we are strong enough, and we are courageous, and we can do amazing things as well. So believe in us. Na pia tunawashukuru sana kwa some of the things that you guys have done in the hospitals, like the caregivers as well, the nurses, the doctors. So we appreciate you so much, because sometimes tunalemewa sana. Unapata maybe mgonjwa amejipupuia, wanapanguza and all stuff. So we thank you so much for each and everything that you guys have done for us. Yes.
I'll want to take a different route, if you'll allow me.
That's okay.
I'll want to talk to if we can do more brain fog. Not creating awareness, but this goes to the government people, like if they can come up with a special package for us, chronically ill, especially SHA, because having these myriad conditions, like it's very expensive, and sometimes even like you'll find, yes, insurance will cover, but up to a certain limit, and to some of us, like not all of us can afford insurance. So, and in most cases, like when you go to the insurance people, like once they realize that this is what you're suffering, the next year they won't renew your insurance. So I think the only help we can get is from the government, and I know there's some work going on. We're still lobbying so that at least we can be listened to. I'd like to encourage the ones who are representing us to continue that and not lose hope, and then also to be listened to, so that at least we can have a special package on SHA that will really help. It will really help us, putting in mind that most warriors cannot hold jobs for long, or most of us cannot work. So you have to rely on either it is Harambes or even your friends. And then there's something called donor fatigue. So you can just ask a certain match. But if we had a special package on SHA, knowing that, oh, if I have to go and then I have to get something like one of the expensive drugs, maybe rituximab, and then it is fully covered and all that, that will really help us. Yeah. And then also on the lab works and all of, because we are chronically oftenly in the hospital, like, so dealing with lab works here and there, each and every time. Yeah.
Wow, that's a good one, and I hope I don't know, maybe some of them are here. If they're not here, I'm sure our word will reach them, since we are also streaming live. Yes, but that's a very good point. That's a very good point.
For me, what I would like to say is we need to create awareness. So many people are dying, and they actually have lupus, but it was not diagnosed early. You see, so like there's a lady who passed away in Arusha, a cousin of ours, like 2 weeks ago, and you know what they were telling me? I didn't know that she was sick and all that. So I said, hey, what did Susie die of? She said, yule ugonjwa wa Natasha. Ni kama ugonjwa wa Natasha. Yani they can see the symptoms of Natasha, but they were not sure what it is. So she just ended up dying. So because people don't know what is lupus, we need to put flyers in all the hospitals. As people are in the waiting room, they'll take a flyer, read, and know what is lupus. Posters everywhere, because as we were walking again, everybody was asking us, lupus ni maandamano ya nini? Unajua? So we start explaining. Even we stayed back with the Joy, and we were explaining to the two ladies what is lupus. Yeah. So they were saying, this is lupus. And we took about 15 minutes explaining to them. So we were the last ones actually to walk in here. Yeah. So they said, okay, we'll pass by and just listen to all this, but you should do more awareness. Yes. Awareness projects, posters, everywhere. Yeah.
Wow, we hear you. More awareness is needed, clearly. More awareness is needed. If this is Nairobi and people in Kasarani are asking what is lupus, so I'm wondering, someone in Kakamega, will they even know what this is? Even if they have symptoms, they will not even know where to go to and who to turn to. So awareness is needed, and I'm glad we started, and we will keep pushing and urge even more people to do this, so that together we can reach the people that we need to reach out to. Sawa sawa. Thank you so much, ladies and gentlemen, for your time and for sharing your story, and for just being open enough to tell us what you have gone through and how your journey has been. So we keep strong and we keep hope alive. Sindio? Yes, on Behind the Diagnosis, we always say that every story matters and every voice deserves to be heard. So asanteni sana for listening to us, and keep watching. More of such stories are on our channel, and more are also coming. So yes, bless you all.
Hiyo makofi jafika tafadhali. Tusiwanyime bana. Si ndio? Wazindikisha na makofi. Thank you so much for that session. All right, thank you so much for that. Tunasema ni asante sana. It is one of the reasons why we are here today. I was here. We are here to create further awareness, to learn from our warriors as well. Caregivers, asante sana Mama Natasha for that story. Very inspiring. Asante sana for the caregivers as well, for the courage, resilience of coming out and sharing with us. So right about now, we want to switch to another panel, a very educational panel as well. This is the doctor's panel, but then again, it will be more of a question and answer. All right? As they make way, tafadhali, make a round of applause for them. Yes, asanteni sana, gentlemen. So, this doctor's session, Q&A session, we'll be having Dr. Eugene Genga. He is a rheumatologist. He'll be here to break down with us. He'll lead this particular Q&A. He'll go first. But then again, it will be the same with the other doctors as well. We have Dr. Sukwala with us here as well. We have Dr. Wairimu Waweru and Cynthia Muhaki, who is a nutritionist here. All right, so as Daktari makes his way, tafadhali tumkaribishe kwa makofi. And ask questions, yeah? Kindly, let's ask questions. Let's be interactive. We have giveaways, so please. Itakuwa more of a bit of interesting session with our Daktari. Dr. Genga, asante sana.
Thanks to the organizers for inviting me. Thanks also to the warriors. This is a very important day to show the world that lupus is around, make the disease visible. So we asked what we want to do for this particular session. I told Joy I'm sure bored of seeing doctors all the time, so we want to make it like a Q&A. Ask questions, we see what we can answer. Thank you.
All right, sawa sawa. Nana tufungulie usukani tafadhali. Let us make this session as interactive as possible. Ama namna gani? Kumbuka tuko hapa kulan. Yes. We have a first straight shooter. Karibu sana.
Thank you. Yes, hi everyone. Daktari, I'm here specifically focused on our young warriors, the pediatric ones. So I wanted to ask about how best to try and ensure that their treatment protocols are taken care of, especially when they're in a school situation where high chance that people at the school may not be aware, or the school nurses and things like this, whether there's any way that can be to ensure that they're able to take their medication, things like this. Yeah, because I know the diagnostic part of it, that journey is really long and can be difficult. Yes, also I wanted to just ask about whether lupus in young warriors is more aggressive than in older patients, or warriors rather. Thank you.
So thanks for that question. It doesn't just apply just to lupus, but for all our young patients who have autoimmune diseases. One of our colleagues here said how she used to be beaten when they thought she was actually faking. And unfortunately, that is the story of what most of our patients go through in primary school, in high school. There's a lot of misinformation out there. It's up to us also as doctors to better educate the public. So for me, what I do with my patients, I usually work hand in hand with the nurse, the school administration. Usually I write specific notes with specific instructions, what to do. And my number is always on call, such that in case of anything, they can be able to reach out to me as soon as possible. Number two, what I do for my stable patients who are in school, the plan is that, one, the reviews only happen during midterm and the end of the term. I know sometimes patients want to come home in the middle of the school, but it interferes with the academic performances. And that, in the long run, affects them psychologically. They fall behind school and everything. So for the stable people, we tell them we see either midterm or end of term. Number three, we really have to have the parents on board. The parents are very, very important in that particular journey. They really need to understand the value of taking the medicines. I see a few cases where the patient gets stable and then people say, you don't have to take the medicine, then they get the flare-ups. So it's up to us as doctors to educate the parents appropriately. That has gone a long way from what I'm seeing from my experience. But I think forums like this is a good idea. I think maybe something for next year. I know we have the Freedom from Hunger, we have walks in school and everything. I think something maybe to consider for next year, having more high schools involved with such things, because I'm sure most of the schools out there have first aid classes, first aid clubs and all that. I think having a few of them here will help in terms of empowering. And the last one, I tell my patients in particular, I tell them, do you choose to be a victim or a warrior? Because sometimes they always, at that age, it's hard because they come to the clinic, they find half the patients are old, and they wonder, why me? Why at this particular time? I'm young to get these particular illnesses. So I really encourage them and try to empower them. And the example I use, a few years ago when I was doing my training in rheumatology, my professor, it's called Professor Moots, he gave me a very interesting story. He told me about the dog for the neighbor had arthritis. So I was wondering, what is Prof coming to a dog with arthritis? He said, yes, my neighbor's dog has arthritis, and he needs to replace the hip. So I was like, okay, what is this Prof talking about? I'm saying, so what do you have done in Kenya? I said, simple, kill the dog, get another dog, and move forward. But he told me, no, in this part of the world, that doesn't work like that. And actually, changing the hip was a lot of money. Close, I think, 2 or 3 million shillings. That was in the UK. So the take-home message is that every person can be affected with these illnesses. It's just that at different age groups, they might have different symptoms, but it's not a must that it's only for the young and also not for the old. In terms of the story, the question about you asked about, the question you asked about severity. So severity is a bit controversial, but if you look at the statistics and the numbers that are there, we see more lupus patients before menopause, very few after menopause. Partly we feel that estrogen may play a role in driving that particular disease, because after menopause, it's estrogen that actually changes, it's actually lower. And actually the numbers are actually less after menopause, and actually we tend to see better patients in the older, after menopause rather than the younger. But also, from some of the research down out there, they've also shown that people who are older are usually more compliant to their treatment. Younger people want to experiment, do many things and all that. That might also help in terms of that. Another thing is that, apart from that, is that the young person has a lot of issues at that time. There's a psychological part, there's a mental part. When you're a bit older, a bit more mature at that particular age, and you really are not as reckless as you are when you're younger. So that plus other factors have been found out that actually the younger people, they tend to have more aggressive disease. But the story about lupus is that every person is different. I don't want us to live here saying that if I'm young and we have an aggressive disease. We have young people who are doing well. We have old people who are doing well. So every person should be treated individually according to what they have at that particular time. Thank you.
Thank you so much. Thank you so much for the question. Can we have another question, please, or concerns to raise from the audience? Yes. Asante sana.
Hi, good afternoon, everyone, and good afternoon to the doctor. The question has just been in my mind and wondering, once you've done the test and it has turned positive, is there a time you may need to redo the test? Like, does the disease get better? Can it fade off with time? Yeah, I think that's a question that has been in my mind for a long time. Just knowing, can you redo the test? And if you do it, do you expect the results to be better, or what happens after that? Thank you.
Thank you for that question. That's also a very popular question for us as rheumatologists. And it goes around how the diagnosis is made for lupus. So I think the misperception out there is that lupus is a lab test. The ANA, I'm sure you all know ANA, anti-nuclear antibody. But how we diagnose lupus is there's a calculator that we have. You have to have symptoms. When you have with the symptoms, and the symptoms, the way we score the symptoms, either 2 points, 3 points. If you score more than 10, plus the lab test, we had the diagnosis of lupus. So in terms of testing we have 2 types. We have diagnostic tests and we have monitoring tests. So for the diagnostic tests, the value in repeating may not make that much sense, because ultimately we are not treating the lab test, we are treating the patient. So things that help us in terms of monitoring going long term is, one, the number of flares, are they reduced? Yes, that's the one. 2, are you on less steroids or no steroids? That's what we want to see. 3, how are your kidneys? Prof will talk about the kidneys. How is your liver? How is your blood? If all that is stable, it means you're on the right path. In terms of the tests that are most valuable to us other than the ANA, is a test called complement C3, C4, something called double-stranded DNA. They can be used for diagnostic purposes, but also can be used to assess how the disease is progressing. Why? Because sometimes I had a patient who once came and told me, Doc, I didn't want to come today, but I said, let me just come. I'm feeling okay. He said, okay, I'm feeling okay, no problem. Let's do the test. So she does the test. Now the test didn't take long. They took about a week to come out. So the day before she came to the clinic, she calls me. She tells me, hey, Doc, I'm not doing well. I'm not doing well. She said the symptoms, she's basically having a flare. So the following day she came to the clinic, she came with the results for the previous week. And from the result from the previous week, she was not doing well. So usually the disconnect sometimes between feeling well and sometimes with the autoimmune illnesses, we are very quick to say, maybe I slept badly or maybe I have a flu. So you really have to know when to look for those clues for a flare. So for a flare, for example, unexplained fevers, unexplained joint pain, fatigue out of the ordinary. If you have an infection, see your doctor as quickly as possible, because that can cause a flare. Too much sun also. I see some people come from like Mombasa for holiday or Diani and they get a flare. So you have to know where the flares are. Then from there now, we do now the C3, C4. Usually complement, the example I give for my patients, complement is like food for the immune system. If it's depleted, you have a flare. Double-stranded DNA is a bit different. Usually on diagnostic, we look at the level that is there. For example, if I diagnose you today at a level of 500, tomorrow you come the levels at 300, you're doing well. 200, you're doing well. If you come there at 500 and tomorrow is 600 or 700, means you're having a what? A flare. Unfortunately, some of our labs don't actually capture some of these parameters. They tell you it's positive or what? Or negative. So it's just up to you to talk with the doctor and know where you can have the test done. But the take-home message is that lupus is not a lab test. We don't treat the lab test. And then the lab test helps us in terms of monitoring the patient, but ultimately the symptoms guide us on the way forward. Thank you.
Asante sana. Thank you so much for that clarification. Wonderful. Tuchangamke. Write them down if you want, please.
My question will be, in Kenya, we work on levels of care. I'm thinking of that person who is out there at level 1. Because one of the challenges we have is on the diagnosis. So at times you're at pain. When a diabetes person comes to create awareness, they'll simply say that the symptoms, I don't know, are drinking a lot of water, passing urine and all that. What are the basics? First, the basic symptoms you need to look out for. And the basic tests you can be done at any level of care that gives an alarm on this is where we need to look.
So thanks for that question. Making the diagnosis of lupus is a very challenging diagnosis to make, partly because sometimes it's a continuum of symptoms. You might have symptom 1 today, symptom 2 tomorrow. I'll give, for example, I had a patient who had initially started with low blood, so a hematologist, then they developed nerve issues, then saw who? So a neurologist, then developed kidney issues. When they're doing the kidney issues, they discovered that she had what? Lupus. But in terms of, if you look at the data that we have locally, there's a paper we published a few years ago with Professor Oyo. The time to diagnosis was very long. And partly because some of the symptoms that we have for making diagnosis of lupus are a bit vague and a bit non-specific. So from that particular paper on this part of the world, we've noted that patients who have a lot of fevers, unexplained joint pain, unexplained blood issues. For example, Otolo, you're low blood. And number 4, skin. They tend to tell you either they use a lot of sunscreen or they get a lot of sunburns. If you have those particular symptoms, it should raise their index of suspicion. Something which is a taboo in this part of the world, I get a bit of referrals and miscarriages. and explain miscarriages should raise the index of awareness and say that probably this may be what? Lupus. I've seen a few patients have lost 4 or 5 for the diagnosis made, which is very unfortunate. And explain blood clots. Usually fight with the cardiology team because sometimes they say, take the blood clot and go home. But I explain blood clots should raise the index of awareness, suspicion that probably you have what? Lupus over there. But apart from that, sometimes you get unexplained water in the lung. These are patients who are treated for TB. Water around the heart, they're told they have heart issues. Unexplained kidney failure also should raise the index that you should actually look for. See if lupus is actually causing. And I explain meaning that there's nothing you can be able to put together and say this has been caused by any particular disease. So as to summarize everything, I said make the diagnosis a bit hard, but unexplained fevers, explained joint pain, blood abnormalities, you have got low HB, you are fatigued, unexplained blood clots, unexplained water in abnormal position like in the heart or the lungs. That should tell you that probably you need to look for what? For lupus. Thank you.
Thank you so much, Daktari. That was a very interactive session, sindio? Tumpatie makofi yake, au sio? Thank you so much for that wonderful session. Now we're moving on to Dr. Sokwala. Thank you so much, Dr. Sokwala. Mtindo ni huo Q&A for him as well, so kindly feel free to ask away questions. Karibu, Daktari.
Thank you very much, and thank you for the organizers, Natasha and the team. Excellent organization as usual, and we always look forward to this event every year so that we can come and talk to you people, have an interaction, how we can improve care in lupus care, how we can improve your symptoms, your diagnosis, and the main thing is, living a healthy life with no, recurrent admissions into the hospital, as well as doing your work, whatever you're doing, your mother, your husband, your daughter, and your family life is taken care of. So I like the Purple Parade. It's a good name, and I'll talk a little bit about the kidneys and lupus. So as somebody asked about level 1 care, so just a simple test, and I've said this even last year, a simple test of checking the urine called the urinalysis. It's called a dipstick. You can even do it at home. If you have the dipstick, you can just dip that into your urine and see if there's any blood or any protein in the urine. And if that's the case, then you know that the lupus is probably affecting the kidneys. So 50% of patients with lupus get kidney problems. That's a huge number. So out of your 2 friends who have lupus, one of them has a kidney problem. And if that kidney problem is detected early, then there's higher chances that you won't end up, like I heard somebody saying their friends is on dialysis, so you won't end up having dialysis. So the trick here is early detection, early treatment, so you can prevent you going into dialysis, going into things like kidney transplant. So if your kidney is detected early, the problem is detected early, there are many medicines nowadays to prevent the lupus to affect the kidney. Okay, there are many new medications which will do that so that the kidney can survive. Lupus can affect many organs, not only kidney, it can affect all the organs in your body, from the brain to the heart, to the kidneys, to the nerves. So again, it comes to early detection, and simple tests, as Daktari mentioned, can tell us how to prevent that complications of lupus. If you get lupus, if you get kidney problem, it's not a life sentence. You can go into dialysis. Okay, at least we have dialysis which does the work of the kidney, and you can get kidney transplant as well. Okay, so when you get lupus, your lupus can still be there, and you can still get the kidney transplant. The medicines we use actually to prevent rejection in a kidney transplant are the same medicines you use for lupus, things like mycophenolate, tacrolimus, steroid, etc. So I think that's a small discussion Natasha told me to talk to you about. But the most important thing is, if you have any questions, we are here to answer.
Asante sana Daktari. And then right about now we're opening sessions for the questions, yeah? So kama tuna maswali, concerns for Dr. Sokwala, tafadhali. Let's shoot them away. Let's shoot them away. If you have questions, clarifications. Nice.
So my name is maybe Dr. Sokwala. I'm a nephrologist, a kidney doctor at the Aga Khan University Hospital. I'm sure some of you we've met before. So don't shy away. Please ask questions for free today.
My name is Paul, and I have two questions. The first one is, are autoimmune diseases preventable? The second one, what about the research? Are they coming up with reliable methods of treatment, diagnosis, and drugs?
So excellent questions. The first question, are autoimmune diseases preventable? I would say yes. I mean, the two things which trigger an autoimmune disease. One is your genetics. You have an underlying, so these are all theories, okay? Theories people have thought about. You have an underlying predisposition to get, for example, an autoimmune disease like lupus, and then you get a second hit, okay? You call a second hit theory, when you get like things like infection or any other thing which would now bring the autoimmunity out into, symptoms. So I would say you could prevent 50%, probably. I don't know the clear answer to that, but having a healthy lifestyle, just like cardiovascular diseases, having a healthy lifestyle, and we have a nutritionist who will talk to you as well. Regular exercise, avoid smoking. Smoking can trigger autoimmune diseases. Avoid alcohol. Just a healthy lifestyle can prevent autoimmune diseases. You would say, in the olden days, maybe these autoimmune diseases were not even there, but you would argue whether they were there, but they were not diagnosed. But I think they were not there because, most of our people in the rural areas, like probably 50, 60 years ago, they used to live a good, decent life, 70 years, 80 years. I don't know, maybe it wasn't diagnosed, but if you lead a healthy lifestyle, I think you could prevent autoimmune diseases. That's question number one. Number two, what was the other question? Sorry, Mr. Rao.
The second question was, what about the research? Are they coming up with new methods of diagnosis, drugs, and the new methods of treatment?
Yes, there are new drugs. There is lots of research in autoimmune diseases. The newer drugs, things like, for example, things like belimumab, the antibodies which prevent the antigens in our body to create havoc. So there are newer drugs, yes. A little more detail on that. They're still a little more expensive, but the prices are coming down with more use of that drug. There's more research on diagnosis as well. You can nowadays even sometimes you don't need a kidney biopsy. You just you look at the genetic map of your blood and see what kind of diseases you have. So there are much more research done on that, on genetics and genetic diagnosis of all these autoimmune diseases.
Asante sana for that. Any further questions? Yes. Napenda mwenye mnachangamka. Hii ndo sasa amkukula school fees.
Hi.
Hi.
I'm not a lupus warrior, but I have other autoimmune conditions, and one of them affects the kidneys. So I wanted to ask, I have Addison's disease, and the adrenal glands sit on top of the kidneys. So why can someone like me just get a kidney transplant and maybe my disease would be gone? Is that possible for someone like me with Addison's?
So instead of transplanting the kidney, we can transplant you some adrenal tissue. So the thing is, transplanting a kidney is a big thing. It's not like child's play. Okay, you'll get a whole big surgery putting a kidney inside you. But with your disease, like the Addison's disease, just with one medicine, medication that's adequate for you to survive your life. But when you get a kidney transplant, you get it from somebody else, and now you have to take much more medications to prevent rejection of that kidney. So it doesn't make sense for you to get a kidney transplant whilst you can just take one small medicine for the rest of your life for your Addison's. Yeah? Make sense? All right.
Asante sana. Do you have further questions, clarifications? My friend hapa kuna napenda venye amechangamuka. Okay, sawa.
Hi, how are you?
Hi.
There's something that you mentioned about healthy living, and you didn't give any guidance or, clarifications. It would be nice.
All right. So the first thing is exercise. Unfortunately, nowadays, it's good I can see the kids running around here, but most of our kids want to sit on the couch, watch the TV, have their burgers, the sausages, the blue bands, and just grow fat, okay? That's the big problem, right? That's the biggest problem in our society now. And, when you see a 10-year-old with a kitambi, which I think in the last 20 years, we could never see that. I'm sure most of us here, when we were kids, we were out playing in the gardens. Unfortunately, now we have apartments, no place to play, no place to run, no place to exercise. So that's number one, right? At least a healthy exercise. Most of us are having a sitting job. So exercise, healthy eating, okay? We want to eat unhealthy stuff until we get into when you go 50 years old, when you're told you have diabetes, high blood pressure, and now you start taking care of yourself. But I think the healthy eating starts at young age, like the kids who are running around here. If we start at that time, okay, then that would have a bigger impact. Because things like atherosclerosis in your blood starts as a child. So those are some of a few things, but we have a nutritionist who will also talk a little more in detail about that.
All right, Daktari, as you wind up, I assume.
Hello, Doc.
Hi.
Let me ask now, when someone with lupus does transplant, how do you balance the drugs? Yet they were taking the immunosuppressive drugs before. How do you do it after now?
Great question. So what now changes is you give immunosuppression for the transplant, okay? You don't, usually the medicines we give that for the transplant are more than enough to depress or suppress the lupus. Because we usually give 3 immunosuppressants after the transplant. And when you have lupus, the maximum you have is like 2, okay? So after the transplant, you will be on the mycophenolate, you'll be on the tacrolimus, that's a CNI, you'll be on the prednisolone, small dose, and you will be also on hydroxychloroquine for your lupus. So I think the game changes from lupus to kidney transplant medicine then.
All right. Any other clarification?
I think there's a question now.
Okay.
There.
Yes.
Hi, Dr. Squala.
Hi.
Yes, I wanted to go back to that aspect you mentioned earlier about genetic testing and what that looks like in the country today. What's the landscape around genetic testing and genetic counseling and how it can help with autoimmune conditions going into the future? Thank you.
So it's a big game changer in the West because it's really picked up in the West. And even here, we have some labs who do this now. You get, especially in nephrology, we have nephrogenetics, a huge topic called nephrogenetics, where, the genetics will tell you whether you have a predisposition of getting, for example, kidney disease in the future, right? And if that's going to help you detect early and prevent the progression of kidney disease. So it is there. It's coming into this country. We have some labs locally who do genetic testing.
Tuko safi? Wonderful. Okay, daktari. Ni kama Watu hawana maswali for now, si ndio?
Great. These guys are more experts than us,
Oh,
actually.
actually,
The warriors are more experts than the doctors in treating lupus. Thank you very much.
Wonderful. A round of applause for Daktari, tafadhali. What a wonderful session. Thank you so much. And what about now? We are going to a palliative and pain expert, right? Pain management. That is Dr. Wairimu Waweru. Karibu sana. Makofi kwake akiingia tafadhali.
Thank you. Good morning. Good. Hey. Nimekula sana, si ndio? Farmer's choice. Good afternoon. My name is Dr. Wairimu Waweru. I am a medical doctor for the past 15 years, and I'm a pain and palliative care resident in training from Makerere. So I would prefer a very interactive session. As Dr. Squala said, you guys are the experts. So I'd like to answer whichever questions that you have, because I know that one of the struggles with autoimmune diseases is pain, isn't it? And a lot of misconceptions around pain. So I'd like us to have a very interactive session, and let's see where we can help.
All right. Okay. We have a first shooter of this side.
Hi, Dr. Ari. Thank you.
Hi.
Now, with pain, you know, you keep on taking painkillers according to how you feel. I don't know at what point do painkillers become poisonous in our bodies, because I personally use a lot of them. And you're moving from, like, let me give you my own case, is that sometimes when the bones in my hands are painful, I'll take a different painkiller. When I have pain sometimes around the pelvic, takes a different one. The pain comes on my feet, I take a different one. And so I am always on painkillers on top of the hydrochloroquine that I take. So at what point should I caution myself and say, this one is too much? Thank you.
Thank you for that. That's a very good question. So we need to understand one thing, yes? That pain is multidimensional, okay? There are very many different causes of pain. And another thing we need to understand is pain has to be managed. You are not going to get a medal for being the strongest person who can deal with pain, isn't it? Because it's going to affect your daily work. It's going to affect the quality of life that you have, okay? So what we advise is have a balance, a good balance of your medication. So assess yourself truly, look at the severity of the pain that you're having, start lowest and go increasing, okay? Also try and identify the cause of pain that you're having. Are you having an inflammatory flare-up? Are you having muscle spasms? Are you having neuropathies? And also look at pain as a whole person. In pain management, you have to look at yourself not as the diagnosis that you have. No. What's your name, sorry? Pardon?
Irene.
So don't look at yourself as Irene. Don't look at yourself as RA warrior. No, that's not who you are. That's not your identity. Look at yourself as Irene, a warrior that's dealing with something, but also has emotional stress, financial stress, social stress, your support structures, okay? And all those things can lead up to pain, can worsen your pain, okay? And make sure you have enough support in those areas. So when you're looking at your physical pain, you deal with the pain according to the severity. So you look at a pain scale of 1 to 10. Is it pull my hair, severe pain? Is it pain that I can ignore and move on? Because unfortunately with autoimmune illnesses, pain is a constant, isn't it? So you address the physical. Look at your emotional status. How are you feeling? How is your heart? Do you feel supported? Do you feel like your cup is filled? Do you need to speak to somebody? Are you feeling stressed? Okay. And support that side. How is your social side? Autoimmune illnesses come with a lot of financial burden, isn't it? It's very expensive. Very many warriors have spoken about the financial burden that comes with autoimmune illnesses. So are you being supported? Is your work supporting you in paying your bills and things like that? And help that, okay? Psychosocial support. You're on high dose steroids that will mess up your mood, okay? There's going to mess up your sleep. So you're not going to sleep. Your brain is completely sensitized to pain. So look at all those things and support that area. And then you add on to the medication that you're taking, okay?
Wonderful. Do you have any contributions? Okay.
Thank you for that question.
I think my question is still on the pain management, especially for us who have autoimmune and contraindications on the pain medication. I personally am a post-transplant kidney patient, but I still have my other autoimmune, the SLE, the arthritis and all that. So what are some of these measures that I can use beyond the emotional, the everything? Some of those relief measures that I can use to keep me off, because even me, abuse of paracetamol itself is more dangerous to me than the pain.
True. All right. Let's take your case as an example, okay? What is one of the struggles in pain that you deal with? Please help her with the mic.
Oh, sorry.
Thank you. So, like in the morning, tell me one of the symptoms that you go through.
No, my issue is with the joints.
The joints, yeah?
I have gout arthritis from the medication.
Okay.
Yeah.
So there are other non-pharmaceutical ways of management of pain.
Yeah.
Okay. So let's say it's in the morning, you've woken up, your legs are very stiff, okay? You can do what we call heat therapy. Have you experienced heat therapy?
No.
Heat therapy. So it's where you put something hot on a joint to help relax the joint, improve circulation, things like that. You can also use it for cold therapy when you're having inflammation to cool the joints, okay? Those are non-pharmaceutical ways. There's also breathing techniques, okay? And progressive muscle relaxation, where, for example, for breathing techniques, and I think we have a wellness coach, MC? We have a wellness coach, isn't it? We have a wellness coach as part of the panel. Anyway, so there's the breathing techniques, okay? Those usually help with, in terms of relaxation. Remember, when your body relaxes, it also reduces your stress hormones. It reduces your cortisol and all the stress hormones that alleviate pain. So you can do those, okay? You can also do the progressive muscle relaxations, where you tense and relax muscle groups in your body to help relieve the pressure in your muscle groups. You can use heat and cold therapy that helps either reduce inflammation, relax the joints, that in addition to the kind of medication that you're using. Have I answered your question? Thank you.
Thank you so much. Do you have any contributions, Santi?
Hi, Daktari.
Hello.
How are you?
Fine, thank you.
Yeah, I just want to know whether there is a connection between varicose veins and joint pain.
I think I would. I am not sure about that one, but allow me to get back to you. I will look for you in the crowd, okay? I know that there is an association with itching. I don't know if my senior, I can't see my seniors, but I'll definitely get back to you on that. Thank you.
Asante sana. Thank you so much for sharing. The online community pia tunasema asante. We are seeing your questions. And we'll be sure to get back to you as soon as possible. Thank you.
All right. Hi again.
Good afternoon.
Good afternoon. So mine has a little bit of a controversial aspect to it. But when it comes to pain management, we talk about like the painkillers that exist and what have you. Things like tolerance goes up. There's also that whole aspect of toxicity. Now, this probably works, it is more probably done by younger patients. And this comes to things like mood-altering substances or psychedelics, which I think in certain Western countries, they're looking into that kind of research so that they kind of change the classification of those away from illegal substances to something close to. So when it comes to pain management, is that something, an avenue that is going to be explored further sooner rather than later, especially in our country here? And the stigma of taking such things. Yes.
Thank you for that. That's a very good question, and I appreciate the fact that it's come from you. I would hope that it's something that is being explored. I'm not sure. I know that there's some countries that are exploring medical marijuana as pain relief. I'm not sure about the psychedelics, but for medical marijuana, I know that there are there's a progressiveness in how we are thinking and destigmatization in terms of usage of medical marijuana and how it's received. I don't know where we are as a country to receive this, so I'm not in a position to answer that question. Yes. But I do know, especially in the young, they are using it a lot.
Asante sana. This is a very engaging session. Ama aje daktari?
Sana.
Napenda hivyo.
There is a question that was asked by my sister there, and you did not answer it. The question was, at what level drugs become dangerous in the body of a person? At what level drugs become dangerous in the body of a person?
So yes, I got the question, but it's very difficult to say what level. Why? Because you have pain, you're going through pain. So we usually weigh the advantages versus the disadvantages. If the advantages outweigh the disadvantages, we do give it, okay? So, for example, my sister here said she has contraindications. There are people who have used NSAIDs for very long, okay? The diclofenacs for so long that they get irritation in the tummy. But it does not stop us from using it. What we can do is protect your tummy so that we are able to manage pain. So, unfortunately, there's no clear way to answer your question. We just have to make sure that the advantages of managing that pain outweigh the disadvantages. Have I answered it? Thank you.
Wonderful. Do you have any concerns, any questions, any follow-up questions? Haya basi.
Thank you.
Asante sana daktari. A lot of applause for Daktari tafadhali. And what about now, as we wind up on the doctor's panel, we have a nutritionist with us, Cynthia. Tulisikiza Dr. Sokola akituambia kuna vitu partake, au sio? So labda Cynthia will have to expound further. Karibu sana. A round of applause, Cynthia.
Thank you so much, Bill. Yes. Hi, everyone. Good afternoon. Kama tuko, please wave. Wave for me, wave for me. Yeah. So my name is Cynthia Boyhakim, and I'm the lead nutritionist at Zuri Health. So we are here to discuss anything nutrition related in terms of autoimmune diseases. As the doctors have said, we know you guys have all the information you need, but again, we are here to walk with you through the whole journey. So first and foremost, things we're supposed to look out for as per usual. Most of you have already visited the table. Mmesikia nikiongelea mboga, ukweli uongo? Vegetables are a key thing that we are supposed to be consuming. And as per usual, it has to be half of your plate. Do we consume half the plate of vegetables? Guys, do we?
Yes.
Do we? Exactly. That's a really big no. So that's the first thing we're supposed to be looking at. Ensure your vegetables are always half the plate. Because apart from getting the vitamins and minerals, they are the things that actually give us fiber. And fiber is one thing that helps us in the whole fight of autoimmune diseases. And also from that, helps with weight loss. And also people who also fight probably diabetes and things like that, helps us maintain our blood sugar levels. The next thing now is how we subdivide the other half of the plate. So we usually have lean proteins, then we have the carbohydrates. So when I talk about carbohydrates, I don't mean the white rice, white ugali, and hapa najua mtanikasirikia kidogo. Ikifika kwa carbohydrates, look at your fist. Simeona? Hiyo ndio kiwango mnafaa kuwa mnakula. Najua nimeguza pabaya. I'm very sorry for that. But technically, that is how we are supposed to be aligning our plate. More or less, carbs should be fist size. And when I talk about that, I don't mean the simple carbohydrates. We are talking about complex carbs. So where do we get that from? The ngwashes, rather sweet potatoes. We have the ndomas, arrowroot. So things that are naturally, that don't really spike your sugar that high, and they also give you a lot of fiber in the process. When it comes to the ugali, ile ya kusaga, mchele najua ni ya brown, na hamtaki kusikia hiyo. Plus also I understand mfuko ya kila mtu haifanani. But so in as much as yes, if you're consuming the simple carbohydrates, always keep caution on the portions that you're consuming, all right? So as we say, we walk with you throughout the whole journey. So nutrition is curated as per individual. It's not like a one-size-fits-all. So you come with your issues or you come with your problems, we're here to walk you through it. So if you tell me today I'm eating this, it's not working well, it's giving me flare-ups, we now alternate and see how else can we change to ensure things are working okay. Another key thing that actually helps with autoimmune disorders is omega-3. We've all heard about omega-3, right? Are we aware where we get them from? Samak. Exactly. Whoever's saying samak has gotten it right. So we usually get it from sardines, salmon, but also this one thing that I know not many Kenyans enjoy eating, omena. Wangapi wanapenda omena hapa? Kuna mtu aliniambia ni chakula ya paka. But ni sawa, then call me a cat. So omena is actually very high in calcium also, but also part of the omega-3s. So we also get that from nuts and seeds. I'm pretty sure you've heard that you can also eat nuts and seeds as snacks or part of things that you can just indulge in. But when I also speak of that, no, I don't mean you sit down and eat the whole packet. It's more or less a handful. Umeona handful vinatoshana? Sijafanya hivi? Hivi. Are you seeing my hand? It's cupped hand. So again, when you're having your nuts can be walnuts, almonds, seeds, you can have flax seeds, chia seeds, but chia seeds kindly add them in water because it needs at least water to be able to expand. So always a handful. Do not sit down and eat a whole packet. You can try and put them in between probably your meals. So if you're a small, frequent eater, that's how we actually reintroduce things into your diet, just to ensure you're getting all the nutrients in one. I think that's also very good is gut health. So gut health is something that we're really looking into, generally for everybody. So gut health is the one thing that actually helps our system. So haiangali tu tumbo peke yake. So it's linked from your brain, deals with metabolism and things like that. So we get things that help our gut through probiotics. So either yogurt, or we can have kefir. I'm pretty sure you've all heard about kefir. So fermented foods such as sauerkraut, that's cabbage that's been fermented. Then kimchi and things like that. So those are just the basic things. So in case you guys need any information, feel free to reach out at our tent. We're still available. If not, you can come visit us at our facility, Manyani East Road. So we are readily available. So now it's time for you guys to ask any questions that you may have. Feel free to ask. Where I can answer, I'll be able to answer.
Yes,
Thank you.
Wonderful. Wale wa kafirifiri kwa ubari.
Kafirifiri ni sawa.
Kafirifiri kwa ubari.
Metabolism.
Wonderful.
I have a question. Mbona chapo and ndengu or beans. Somebody told me they're both carbs. So I'm just wondering, is it a good combination? Is it healthy to have that? Or am I just doing more of carbs?
So this is something that's coming up now of late. Other people are mixing it up. So what you guys don't know, every food has different components of carbohydrates, proteins, vitamins, and minerals. So when it comes to what we call now the legumes, the beans, the dengus, the minjis, they are more or less high in protein, but they do have a bit of carbohydrates inside. All right? I'm not saying that now you eating chapati and dengu is bad. It's actually okay. You're still getting the amount of protein that's needed in your body. But let's say for someone who's diabetic, it's something you also just need to put in mind in terms of blood sugar, because you need to match your meals. So when you're having that, you're okay. All right? So you're still having your protein, you get the part of carbohydrates or rather starch from your chapati. Chapati ni moja. Ni moja, guys. I'm sorry. Again, it's one. I know. Sawa basi niko na halfway. If inafanana transparent, if you lift it and you can see me, I can probably give you 2. But but if it's round, it's okay. Just one. Okay? I understand you will cry, oh, I'm feeling hungry, I won't get full. But again, that is where I was insisting on the fact that vegetables need to be half of your plate. We are getting our satiety from that. So it's not the usual olden or rather African way we've been taught, I have to eat a lot to get full. That's a myth. And also this habit we have of eating a lot, rather if I didn't eat lunch, nitalipiza supper. You're going to bed. Where is all that energy going? Your body will just take up what it's supposed to use, then it will convert the rest and store it as fat. All right? Then you'll ask yourself, I've been trying to lose weight, I've been trying to do this, nothing is working. It's always what are you eating and what's your portion size. All right? Next question.
Before next question, hiyo chapati, hiyo brown, hiyo pia ni moja. Hiyo si ni sawa haki kusema ukweli. Sawa.
Already tukishakulia brown, you'll feel full already. Whole grains, high fiber, satiety, meaning fuller for longer.
Wonderful.
I think I'm one of those. Now, we are supposed to do, I don't know, whatever you've demonstrated. There's some of us here, and maybe the general advice you'd give people from different perspectives. And I think I'll use my situation of someone who has high uric acid, high PTH, I don't know, high creatinine, I don't know. So I don't know, you've been told to limit purines, limit potassium, limit phosphorus, I don't know, increase or what's that one advice you can give such a person on their diet? Because you look right, you talk about brown chapo, I'm told I don't know it has potassium, it has phosphorus. You say veggies, I'm told that's where potassium is. You talk of omena, I'm told it is high in purines. So exactly, you're on steroids, I don't know, limit calorie. Huyu mtu atauliwa na njaa ama chakula. Ama I choose my choice.
They say pick your poison. So again, this is where, like I said, we curate things like specifically for you. We'll come, we'll have a sit down and see what you've been taking. We see what you can minus. As I said, most foods have everything. It's just the amount of quantity that's found in everything, all right? Like vitamin C, we know we find it a lot in citrus foods, but we can still get vitamin C from vegetables, all right? So maybe you can come to a tent, we can have a one-on-one and see how you're faring so that we can move along. That's all right? Okay.
We have a question hapa halafu nikuja.
Hi, Doc.
Hello.
You're well?
I'm good. How are you?
I'm very well, thanks. Now, same question. I'm a DM patient, stroke a CKD patient, and there's a thin line between the dietary requirements, seeing that CKD you are told not to do brown stuff, brown rice, brown chapatis, then the DM demands the same. So I'm really always torn between the two. Because now if you tell me to do the small chapatis, the small ugali, when I do the veggies, they give me high urea. So for me, it's more protein, more starch, to be honest.
But what kind of starch are you consuming? The white rice.
Of course, the white rice, the white ugali, then it spikes my sugars.
The vegetables, I know they are also subdivided into what you can eat and what you cannot eat. So again, since it's between me and you, come, let's have a chat and we'll discuss more.
Sir, thanks you.
Hi, Doc.
How are you?
My concern is around detox. We currently have so many natural therapies that revolve detox. So some of us were on very many medications. So you're torn between, and we're told detoxification is good, it actually clears your system. So you're torn between what is right in terms of the natural detoxification, and will it wipe away the drugs that are in the body, or how do you run about that?
So when it comes to matters detoxification, we usually say the liver does everything on its own. But when we try and reintroduce diet in that, you will tend to see that we fall more on vegetables and a bit of fruits inside, right? So I wouldn't say that it will clean or rather clear everything 100%. It's just more or less helping your organs to remove what's not needed in your system, all right? So it's more or less how do we combine which vegetables and which fruits together to just help your body work naturally to remove anything that needs to be removed, all right?
Wonderful. Do we have any more questions, clarifications? Yes.
Hi everyone, I have a question. For those of us who are dealing with weight loss, like rapid weight loss, you find that in like a few months you've lost like 10, 15, 20 kgs. What would you advise?
So when it comes to weight loss, normally we talk about increasing protein. But again, I have to sit down and have a talk with you. We see that you don't have any other underlying conditions, or rather if you have, how do we work through that? Okay? So again, for you, see me at the tent. Not in your tent, but come see me at the tent, all right? So I will see if there's anything.
Asante sana. Okay.
Hi, Dr.
How are you?
I'm good. I was told you are the expert on healthy living, so I don't know how you can add on to what previous doctor talked about.
All right, so as I had explained the first time, you are already aware of the things I mentioned, right?
Yes.
That you wanted to castigate me on, veggies and whatnot. Yeah. So apart from that, in matters healthy living, as Dr. said, we are always combining nutrition and fitness together, all right? I do understand there are point in time maybe you're not able to move a lot, or rather it's painful when you do that. So we sit down, look at what else can we do. So that is number one. I've already expressed how we're supposed to be eating in a normal basis, but we are able to offer adjustments dependent on every individual's problem. But the key things I've mentioned, omega-3 has to be there, vegetables, proteins, carbs. Fruits also have to be included there. Portion sizes, as I've said, portion and also what's on your plate. But exercise has to be a thing that you do. Hydration also is necessary. So if you are not limited on the amount of water you're supposed to be taking, 2 liters is what is necessitated in a whole day. This is more or less 6 to 8 cups throughout the day. So if you're able to subdivide them into your hours throughout the day, that will be all right.
Still on the detoxification part, yeah. So when you detox, will it like drive out also like all the medication that you're taking?
Not really. Again, as I've said, it's just helping your organs function as they're supposed to, because we're using natural nutrients to just cleanse your body. All right? So it's not like that we'll be pumping you with other drugs or you using other things to just detoxify. You're just using natural ingredients.
Hi, Dr.
Hello.
Once again, the shock of the chapatis is yet to wear off.
I know,
But, however, working with the kids, when we, in a situation where like if you have a children and they're young and they go to a party and things like this, or leaving the house, what are your best practices for how to ensure that your child is able to eat the most nutritious food, especially when you go to a place and you find like there are mahamris, mandazi, kuna, you know, all the fun stuff as children we like to eat, or cereal and things like this. Thank you.
So, again, this is one thing I always tell everybody. We are human at the end of the day, and we all have cravings. Even me, if you see me here, I do have days I have my own cravings. It's not like I will not eat the fries and whatnot. I will. But the thing is, I don't do it on a regular. It's not a Monday to Monday kind of thing. I understand when kids go outside, even as Africans, even when we are hosting parties for our kids, what do we usually have? Popcorn, crisps, biscuit, sodas, and whatnot. So once in a while, it's okay. Because it's not like they're going to parties every weekend. It's here and there. It's okay. But now you as the parent is to watch out on how much are they having. Remember, refined carbs, rather excessive sugar, is not good. So we start teaching our kids early on, then it will translate to how they live further as they grow up, right? You see, like how mentality we have as Africans that lazima tukule chakula mingi ndio tushibe. It's a thing. But as I've said, and I always sing about this, portion is what matters. So I'm not saying now you start putting a lot of rice or ugali on your plate so that you can feel satisfied. The secret, rather, the key is in your vegetables. So when your kids are outside, allow them to have that. But also it's up to you as a parent to monitor how much they're having. If it's those times when we're usually having family outings, you're going out, having lunch and whatnot, you order for them something that, you know, is a bit nutritious. Yes, fries, again, people outside, they can have that. But it's not supposed to be an every time when we're going out. So look at the portions that have been brought. Maybe you have your protein there, you have your veggies, you have your rice. If it's too much, you can as well put half aside, can be eaten later, and eat what's left on the plate. All right?
Yeah, we have another question here. On your right side. Yeah.
Okay.
Hi, Doc. How are you?
I'm fine. How are you?
Good, good. You see what I do?
Yes, I have. I saw some nice cookies, some nice cake that called to me.
Occupational hazard for me. How do I lose weight? And I have a very short period of time to lose weight because I have a target. I've been given a target. What my biggest question is, how accurate is this BMI? I tend to think it's a Caucasian thing, Muzungu, because apparently I'm obese as per the BMI. I don't know how accurate is it, because someone else will look at me and tell me, no, you're not overweight. Okay, I'm speaking on my behalf, and I have a warrior who has an extremely high metabolic rate, and we are struggling with adding weight, and she's a CKD warrior. So how would you help? What advice would you give us?
So it comes to BMI, I know it's something people usually say, Zungu and things like that. So we use it as a tool of assessment just to see where someone is lying, all right? So you might find that you are overweight at a certain point, maybe your height and weight is giving overweight, but you might also be working out. You might find someone who's not working out is overweight, you're working out, you're overweight, all right? This is where this whole complex thing comes in terms of muscle and fat. And this is why things have improved in such a way now we have a body composition analysis machine, all right? So, yes. So this is something that's able to tell us more than just your weight and height, or rather BMI. We're able to see your body fat, your visceral fat, your subcutaneous fat. It will give me your muscle mass. I know you're looking shocked, I love it. Your bone mass, and apart from that, it will tell me if you're having enough water, enough protein, water of your BMR and metabolic age. So we just don't use BMI only. We have other ways that we can be able to assess and see how we can guide you better. All right? So you're saying you're trying to lose weight. I don't want to ask this question around everybody, but my first question is always, what have you been doing about it? Or rather, what are you doing about it?
I have to taste my ingredients.
Ta-da! So in as much as you're tasting, kuna kutaste na kuna kukula. You might be tasting and be like, oh my God, this cake is so nice. You eat a full one. You taste another one, it's very nice. Again, so now it becomes a cycle. So again, with that question in mind, you'll have now to answer a few things for me to be able to curate maybe something for you and something that can work best for you in terms of trying to lose weight. As for the high metabolism person, as I've said, different individuals, let them come so that we can have a discussion to see what they're eating, what they're not eating, so that we can have a curation of something that can help them.
One last question.
All right.
Issues with the rhesus factor for blood and a particular type of rhesus factor loving wheat. Is that a myth or it's something that is true?
I don't think it's correlated to anything. It's the same way on a Samanga blood group or on a photo on a mosquito. Well, not really. Let me use me as an example. I'm a bee, and mosquitoes still follow me.
Who is his blood group O? Tuambie kama wanasikizana na mosquito. Oh, mosquito hazikupendi. All right. Who else? Any other question? Yes, sir.
Can you talk a little about the supplement which are used as diet? Supplement which are used as diet.
Diet in terms of like what form of diet?
Okay, there is those drugs which someone for vitamin C, drugs for supplement for vitamin C. Yeah, some supplements which are used as a diet. Now, I want you to speak more about supplements which are used as diet.
All right, so first things first, or rather what we need to know, supplements do not replace food, okay? So in as much as, yes, people are often supplementing things, again, as the word said, we are supplementing on something. One thing I usually say before you start taking a supplement, kindly do tests. Don't just give yourself something that you're not probably lacking in your body. And I know it's a thing that's been happening since the era of coronavirus. So unless it's something that you really need, don't use, rather speak to a practitioner who can be able to guide you through that. Most supplements, as you're saying, probably the vitamin C's, and some people usually take it for just to try and boost their immunities. More or less those who are going through flu symptoms. As at now, you know there's a flu going around Nairobi, so there's a rise in how supplements are being used. So again, I reiterate, do not give yourself supplements if you do not need, and if you do need, kindly speak to either a nutritionist or a doctor so that they can be able to guide you. Supplements do not replace diet. Tumeelewana? Ama ni shout? Tuko sawa? All right.
Wonderful, wonderful. Tuko na maswali kweli ama? Yes? Thank you so much. A round of applause for our nutritionist. Mtumpige makofi, yes?
So before I leave,
yes.
Also remember at Zuri Health, we are able to work with you throughout the journey. We have the continuous care program where we are able to guide you through everything. You're able to speak to a doctor, a nutritionist, and be able to do some tests. So you can follow up at our table and get more information on that. So again, you're not walking alone. We are walking with you. All right? Thank you.
Asante sana, tumpe makofi tena, au sio? Thank you so much, our nutritionist, for that. And also want to thank the online community because they are sending in really, really important questions. It's unfortunate that the target, most of our daktaris washatoka, but tunasema we'll be able to tailor your responses either through, of course, after consultation on social media, through informative carousels, and also videos from our doctors to try and just iron out some of the key questions you've asked, because they're really, really good questions. So a massive, massive congratulations to you as well. But one more time, nataka kusikia, when I say purple, you say parade. Purple? Purple? When I say awareness, you say matters. Awareness? Awareness? Napenda hivyo, napenda hivyo. Kuna Sykes, ndio? But then again, yeah, we are getting to the final panel. That is the advocacy panel or the psychosocial panel. And it's also quite key and very important that we do participate in the listening and also participate. Should you have questions, we could ask, because this is one of the panels. This panel will be able to, explore various factors from mental wellness, from the patients' voices themselves, our warriors, to get to hear what they have to say. And but awareness is very powerful. But it is through advocacy that we do get to inject and change, systems, policies. So, online community as well. Should you have any questions for this particular session, kindly do forward them. We'll get to share and also possibly answer them. And for this particular panel, we have our founder Joy, who will be moderating, and she'll take us through who she has on this particular panel, and hopefully we get to listen and be engaging as well. Sawa, Joy.
Good afternoon. Good afternoon, everyone. Karibuni sana to the last panel of the day. So this is the psychosocial panel. And so we've already heard from doctors, we've heard from warriors. So now we look at the psychosocial aspects of living with an autoimmune condition or life with an autoimmune condition. So with me here, I will let my panelists introduce themselves as we continue. So I will start from my far right. Okay, Zanel can go.
Hi, everyone. My name is Edward. I'm a co-founder of the Lupus Ascending community. Our primary focus is on the advocacy and awareness regarding pediatric lupus warriors. And that is where our core efforts reside, because my co-founder is actually a warrior who started her journey when she was young.
Hello, everyone. My name is Zanel Nguriathi, and I am a wellness coach and therapist with Nafsi Wellness. And my job is just to help adults play better, really. Yeah.
Hello, my name is Esther Ashira. I'm a host of a YouTube show, health show, called Behind the Diagnosis, where we create awareness on rare and autoimmune diseases. So ours is to amplify the voices of the warriors and also listen to specialists.
Good evening, all of you. My name is Njeri Catherine. I am a warrior, lupus and renal, and a patient champion and advocate.
Good afternoon, everyone. I'm Dennis. I'm the team lead for mental health at Zuri Health. Basically, what we do, we try to make healthcare as accessible as possible on the African continent. We provide telemedicine. We have virtual consultations regarding mental health and whatnot. We really want to make the issues surrounding mental health to be as accessible to the whole continent as possible to every individual on the continent. So let's have a very interactive session. If you want to come say hi, come say hi. You have a very nice panel here. Let's take care of your mental health.
So my first question is going to go to Catherine, who is speaking on the policy and patient voice. So my first question to you is, in your experience, what have been the advantages of advocating your cause as a patient?
First of all, as a patient, the first thing that you get into once you're diagnosed is pain and disappointment. So it has helped me help others to turn that pain into purpose. And making it a purpose is not only on creating awareness, it's also on okay, showing people, like giving this a face, giving the illnesses a face. And so we are able to think beyond just that diagnosis, but the purpose of bringing the patients together, showing them they have a voice, helping them navigate the healthcare, the wellness, and all that for a good prognosis. The other thing is, I think we are told if you're not at the table, you are on the table. So it has helped me in advocacy as a person lived with lived experience, get involved in policy making, get involved in navigating healthcare, reaching out to and educating our patients. Because some of the things that most of us are struggling with is navigating the healthcare system. So as a person with lived experience, I'm able to advocate on the proper, accessible, equitable, affordable healthcare, and also guide our fellow patients to be able to that. And also in advocacy, we create a community of showing that the patients, that we are not alone. And actually, we are the subject in all this. We can't leave it to the leaders. We can't leave it to the healthcare people. As a patient, I always say, the rest are reading books. We are writing our own. So our voice is key.
Amazing. You've left me with 2 punchlines. We are writing our own stories, and if you're not at the table, you're on the table. So I hope you guys have learned from that. And I'll go on to Edward. So from what you do at Lupus Ascending, what are the main advantages of a patient community and support group?
I think the main advantages are to cover the aspects that regard the mental, as well as that whole social unity, as well as support, because you feel that you're part of a community and you can help each other and you understand each other's journeys far better than a supporter or a caregiver would. And also, in that sense, as you come together and you talk about what you're going through and how long you've been going through it, you find that your community members will have insights into that. Where as caregivers or even healthcare professionals, we can be coming from a place of most likely ignorance, or in some cases you find that when a caregiver gets to the point of compassion fatigue, when you're talking to your own members within the support group, you can find that there's an extension of an understanding that maybe the caregiver might have reached or approached a wall. It's not something that is completely like a block that they can't go through, but it gives people an opportunity to also explore that patience and grace. So I think communities are very important because they cover that kind of psychosocial aspect that most warriors face throughout their lives. And in many cases, as speaking to somebody who's a supporter, there are times where I've also let my own warriors down because I was not able to fully comprehend what was going on. But within the group, someone else comes in and says, don't worry, and also extension of things like faith and guidance as well there. So those are the advantages that I see. Yeah.
Amazing. Asante sana. So I'll move on to Esther. So Esther hosts a show called Behind the Diagnosis. And yeah, you guys should check it out on YouTube. We're also doing the live show through their show, and we are grateful for that. So your question is from a psychosocial perspective. What happens to a patient's sense of self and mental health, well-being, when their stories are finally shared authentically?
Okay. So one thing that I have realized while hosting Behind the Diagnosis is that many patients don't just suffer, or warriors don't just suffer the illness, but isolation. So once we have someone share a story, even for them, they feel, wow, there is a burden that I've lifted even while talking. There are those who have never even talked about the illness even before. And when they come and they talk about it, they're like, wow, I am ready to face the world even with this. And there are those who watch even from home. And like there's an example of one who watched and he was like, I didn't know there's someone else with an autoimmune disease. I thought I was alone. And he had isolated himself from so many people, touch groups and all that. But once they hear someone else sharing a story, they're like, oh, and they're very positive. Whoever is sharing a story is positive. They're like, wow, I can also conquer. And now they face life head on. Yeah.
Nice, wonderful. So the next question, I'll address it to Zanel, who is a wellness coach and also former therapist. And so for someone in the middle of a health crisis or an advocacy burnout, what is one simple play-based or experimental tool that they can use to regulate their nervous system at the moment?
Okay, thank you so much for that question. So the first thing you can do is there's this game we call 5, 4, 3, 2, 1, which is 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can, what's the last sense I left out? Taste, yeah. So you can alternate those senses as you see fit, but this really just helps center your senses. So I know everything that goes on in your body can be a bit overwhelming, but when you focus on the senses, which is sort of what mindfulness is about, it helps you pull the focus slowly but surely out of that experience and onto something else. And obviously it is something that takes time, practicing mindfulness, but you'll find over time you're able to move your state of mind slowly but surely where you want it to be.
So maybe you could just also demystify, do these practices like cure? Because I know a lot of people look for quick fixes. So maybe you can speak on that as well.
Wow, cures and chronic illnesses. Those are 2 different, what I can say is the mind is a powerful thing. And we're still learning how powerful it is. So I would say mindfulness has worked wonders for me. However, I am not a survivor of lupus. I'm a supporter, so to speak, but it has worked for me and has worked for my clients. What I can say is the best way to know how well it will work for you, not as a cure, I would say, but I would like to call it as an aid for how you deal with your day-to-day, is to practice it and see for yourself. Because I could sit here and preach about the wonders of mindfulness, but at the end of the day, different things work differently for different people, depending on how often and how effective they practice it. So I think the onus is to whoever would like to give that a go. And I would just like to say, be patient with yourself. Take time to observe how these mindfulness practices resonate with your body and get to learn yourself. Yeah.
So if you're interested in the play therapy that Zanel does, you can see her at her table in the tent. Yeah, you will just see some colorful manillas hung on the wall. So we'll move on to the clinical aspect of this.
Sorry, I wanted to touch a bit on what she had mentioned. The thing about grounding exercises, they're not specifically for even lupus patients. It's something that you can apply to anybody, even to the caregivers. I feel like in most cases, especially tough diagnoses, they don't even affect just the person who has the lupus. It affects the whole family, the husband, the kids. You'll have flare-ups, you'll have emotional troubles with emotional regulation. Even you, the person, the caregiver, needs to be taught these grounding exercises so that you know that when your emotions are all over the place and when it's your amygdala that's taking care of your reasoning and your thought processes, you're able to say, let me use some grounding techniques to make me self-regulate and to be able to think in a logical sense. So it's not basically for people who have tough diagnoses, it's basically for everybody. If you have a mind, trust me, you need a grounding exercise. A therapist will tell you that,
Awesome. So to your question, so as a therapist specialized in chronic illness, how do you differentiate between clinical symptoms and then also like when it's just a really bad flare-up or it's like chronic fatigue and it's weighing down on me?
So in this particular instance, you first have to realize you as an individual, as a therapist, as a practitioner, you might come with a bias. Someone with lupus might be sitting across to you and you might not necessarily catch on it that this person is in a shitload of pain, right? Because of these biases, you need to engage with other multidisciplinary teams to know that, am I able to reach out to this particular practitioner to know that they can be able to pick up something from this and this and this. And for you to be able to have a rapport with the client who is sitting close to you, to be able to develop a therapeutic relationship such that you know the both of you are working towards a common goal, that they are not telling you something that's off the book. Whatever they're presenting with, they're presenting it with a pure honesty of wanting to be treated by you. Yeah. So there is a lot of things that you can do. There is a lot of multidisciplinary teams around care of such a patient that you have to engage with. It's not just you to say, nah, mtu asikie uchungu. Yeah. Unaona ile kupima na macho? Hiyo hapana. Yeah, you have to make it a collaborative effort to take care of this patient, because this patient, you as yourself, the person who doesn't have lupus, you can't truly say that you are able to step in their shoes and say, I know for a certain fact that I can tell what you're going through. You can't. Yeah. So
do you also integrate play therapy in your work as a clinician?
So most of us, mostly at Zuri Health, we do diagnosis, we do virtual sessions. We don't, because we deal with patients over 9 countries, we are not able to interact with them on a physical session, on a physical level. Mostly we have to deal with integrate therapist who is close to them. And the issue with play, the good thing about play therapy, I will say personally, it's because you get to nurture your inner child, you get to interact with the thing that's meaningful to you as a client. I get to choose which kind of activity I'm going to engage in the moment I step into a therapy room. So in that way, you get a sense of command of your medical journey, your healing journey. And in that sense, it boosts your emotional, physical capability in terms of tackling lupus. And even the grief surrounding it, because there is a version of you that's projected, say, when I reach 50, I'll be running 50 kilometers. But now you have lupus and you have to remodel the way you think about your future. How do you work around it? But then when you do play therapy, then it means you have a certain control of where your future will lead to a certain extent. So it's more patient-oriented rather than a doctor telling you, leo tunakanda chapo. Right? Yeah.
Okay, amazing. So we'll move back to Catherine. And how can patients who feel too sick or too tired to be activists still make sure that their voices are heard by decision makers?
Or I can say advocacy doesn't have to be loud or physical or up and down. Advocacy is, first of all, your story. Even on your hospital bed, even on your wheelchair, just that one voice, sharing with that one person. Sometimes I think people feel like some of these stories we share for attention. But I can guarantee you that every time you share that story, somebody somewhere will pick it up and they'll want to know more. The other things you can do is that you can participate in some things. You can participate in surveys. You can give feedback where need be. Right now, as autoimmune patients and lupus patients, we are trying to push for inclusion in our National Health Insurance Fund, the SHA. It doesn't take you taking a placard with solidarity. It just takes you to take your phone, just go to the panel portal, submit your concerns, submit your recommendations. Have your voice spoken in every forum that you get. I think one of the things that we need to know as patients is that the only way out of all this is policy changes in this. Let's borrow from our politicians. They are telling us what we don't want to hear. Can we tell them what we want to hear? Enda kwa hiyo mazishi, speak out. Anytime you get an opportunity to get that microphone, those people who have come to that house to sympathize with you, because I think once you're very sick, Everybody comes to your house, they are praying and everything. Talk about it. Talk about it. Talk, speak, speak, speak. Give your voice. We are the voice. We are the books to be read. We are the ones to share our challenges. So you are never too weak. You're never too small, or you're never too poor to make a change. Somebody somewhere will listen, and we are going to get. It is the response. I always say that the only way we are able to get the healthcare that we need in this country is not through handouts or everything. It's about the policy changes. I need to get what I get as my right as a patient. That healthcare worker, I think Dr. Sakura was very clear when they said, and it's been a challenge in this country, where I remember we used to be told kitambo, I think as tulikuta that era when it was ending, of daktari telling you, zunguka, toa nguo, dungwa sindano. You don't even ask why you're being injected or everything. People with lived experience, we actually know how it feels. We actually understand how it feels. And I think most of the lupus patients here, I don't know whether they share the same story. It's not every clinician who will go and listen to you. I've gone to a doctor and my issue was post an accident. Nilikuwa nimegongwa jicho. And the doctor actually closed the file and they looked at me, oh, lupus. I had to educate them because some of these things are strange. Not that they are not educated, but you read in the books. But have you faced this person? So any person you come into contact, if you're too weak, that means you're seeing a doctor somewhere, you're talking to a pharmacy somewhere, you're talking to that clinician. Give your feedback, talk it out. Always make sure everywhere you go as a warrior, as a patient, you've left that person with something about it. And they'll think about it, they'll pass it on, and that's how we advocate for better healthcare.
So advocacy is not just about being loud and going to the road like we did today, which was also fantastic, but in your own personal space, try and talk to someone about what you're going through. That's still also advocacy. Yeah, thank you for that, Catherine. And so we'll go back to Esther. So a lot of times in the media, they portray health stories and struggles from a perspective of pity. So how do you as a creative producer now rewrite the script to show the side of resilience and strength? Yeah.
Yeah, for me, I look at many angles in the story, being a storyteller. I don't just look at the negative, because again, even in the negative, you will find the positive. Even in the weakness, you will find the strength. So for me, it's more of listening and allowing the warrior to tell the story without any filters. Just speak it. And if you watch, I listen more than talk, talk. And through that, I also make sure that we are creating a community out of it. As much as, yes, we are creating, it's not just about awareness, it is beyond. It is beyond that. So you get that someone comes, like for example, you came and so many people connected to Thrive community through your story. So we are creating a community, and you'll realize most of those people now know each other. They can even engage. Even the engagement, just making sure that there's also an engagement even on the channel. People are saying, oh, I went through that. I need that doctor's contact. Like, it's beyond, it's connection, it is creating a community and just building something that probably was not there. Because most of the time we tell stories as if they're news, but it is no longer news. We know what lupus is. If you don't know, can you learn from Daktari? Because you see, again, we don't just tell the stories of warriors. The doctors also come and just assure that yes, we are doing a research. We ask hard questions. This is what we are doing. This is where we are at. This is what we are doing. Yes, we had this patient. and we help this patient go to remission. How did it happen? Can someone else get to that point again? So it is going beyond just the symptoms, beyond the down stories, but the victory stories as well. Because we have people who come and they were like, wow, I was at a very bad place. And you know, if someone else is at that particular place and they hear, oh, she was there, and now, because like GBS, someone came and when they came, they were walking. And when you see their pictures before, the videos before, they were like bedridden completely. They could not even hold a spoon. And someone else reaches out and say, whoa, can I connect to that lady because I'm at where she was before? So for us, it is beyond. We are creating hope and just telling the stories of hope again. Like there is hope, ukombele. Yes.
So it's a very holistic picture of like a before journey and an after
And
journey.
an after, yes.
And how you pushed through
Exactly.
to get to where you are today.
Exactly.
Yeah, awesome.
Yeah.
Awesome. So we'll go to Zanel. And my second question for you is, having transitioned from traditional therapy to wellness, I have lost. Yeah. So having transitioned from traditional therapy to wellness coaching, the clinical concept of we need to translate into, having transitioned into traditional therapy to wellness coaching, what do you believe is the most clinical concept that we need to translate into a more accessible everyday practice for our warriors?
So there's a concept called interoceptiveness, and it's basically a big word for taking time to learn your body's signals. This is something that I've also observed as an individual, is that we are so used to taking external cues about ourselves. So we get feedback from other people about how we dress, who we are, or what's wrong with us mentally or physically. When we are sick, we are only aware of some general cues, you know. When it comes to lupus, because it's an illness that's not as visible, it tends to be swept under the rug. And if there was no community, there would be no other way for people to actually know how to live with it. And so basically the big word I've just described is people learning how to sit with and understand the signals that their bodies give them. Because everyone's body communicates differently at the end of the day. So it's very important that you sit even with the discomfort that the body is sending and be able to learn why your body is doing this and just collect that data, those patterns of data. And sort of like, I don't want to say be your own doctor first, because you are the source of data, so to speak. So it's important to have a very clear set of signals before you communicate that to another person and have them tell you what the problem could be. And that I'm taking from, obviously, when it comes to the clinical set, we do analyze everything, but it's also important for the client or the patient to have that awareness that, let me look within. So I think it's something that I can encourage people to get comfortable with. As much as it can cause discomfort, it's very important.
Yeah. To go beyond the discomfort.
Yes.
Yeah. I know a lot of people who have a hard time sitting in silence.
Oh.
Listening to themselves.
Yeah.
Yeah, you end up reaching out for your phone or looking for a snack.
For sure.
Yeah, yeah. Okay. So back to Dennis. So for a patient living with persistent pain, the goal isn't always to be cured, but to improve, like the functional outcomes. So how do we shift the mindset, the community's mindset, from waiting for somebody to get well to living a full life while managing the condition? How do we shift the community's mindset from waiting for that tungoje hadi apone to let's just live a full life, but we are managing the condition?
I believe it starts from a point of compassion, from the individual level and from the community level, the support structures around this patient. I believe we need to realize everything that we see out here, you as a human being, you're a social creature. You're able to know that you have a dad, you have a mom, you have siblings, you have friends. At some point, probably you'll have kids. You'll never know which condition is out there that might present in your own timeline. Are you able to have compassion towards each other? Are you able to say, I'll be able to present to you if you need me? Are you able to say, as an individual, hi mama, Sasa. Are you able to say, I have a friend with lupus? Just give me a call. Tell me the day when you are having a clinical appointment. I'll come pick you up, regardless of whatever is happening to you. And with this particular foundation, I think as a community, as a society, we will be able to integrate everybody with each and every kind of autoimmune disorder. It starts from an individual level. You need to check on things such as self-soothing. You need to know what works for you, even when the pain is at its worst peak. Are you able to say, yeah, this is happening, but it won't prevent me from enjoying my life? I will go for a walk today, regardless of the fact that I'm in pain. And when it comes to self-discipline, you're able to say, I will curate health-seeking behaviors. If my nutritionist is telling me, don't do this, I won't do this, incorporate more veggies, kula mrenda, whatever you have to do. So there is a self-soothing part of it, there's a self-discipline part of it, even the creation of boundaries around your mental health. Are you able to say, there are people in my families that don't actually accept me and my diagnosis, that if I tell them I'm in pain, I can't show up to a wedding. Umse anatumianga diagnosis yake kulenga hizi engagement. These are things you guys deal with, and we know them because most of them have been speak about them in therapy. Nobody will ever know you as much as you know yourself. So have a lot of self-compassion, create self-soothing, whatever works for you. There is no one kind of exercise that fits all. There's one that works for you. Inaweza kuwa unashika masikio unasikia vizuri, or walking on grass. Whatever you do, whatever works for you, then have the self-discipline. And as a community, as a society, we need to know that you are one accident away from having such a condition near you. So have the compassion of the people who are presenting with this kind of diagnoses, because you can never tell. You can never tell what's happening in the future. Yeah.
And also think it's how the person responds to their own situation that the other community people will now know how to respond to them as well.
True.
Yeah.
We're someone niko lupus and this is me.
Yeah.
You either like me or step. There is like 8 billion people out there.
Mm-hmm.
But this is how I'm presenting. I'm comfortable with my condition. I'm managing it, and I live my life to the fullest. Yeah.
Okay, sure.
Maybe let me add from a warrior's point of view. What we need to know as patients and as warriors, it's not a sign of weakness to express how you're feeling. I am so sure, like majority of us today, and I think including Joy here, tomorrow we'll not be able to wake up. I don't apologize. You don't need to apologize, because you are not going to, if you push yourself so much, that means you get to a breaking point. So I'd rather skip, as he's saying, on what you're doing, and then I regain my energy, and I come to, it is never a sign of weakness to take care of me. Yes.
So we'll get to the last round of questions. And Esther's, your question is a bit different from everyone because it's a production question. Yeah. So if you could produce one must-watch moment for every Kenyan to see during the Purple Parade, what core message do you want that story to live in their hearts?
That a diagnosis is not a death sentence, and you can turn your pain into purpose. I've seen so many people here, like Soyan and the rest, who are doing so much, something that started like a therapy, and now it's a business, and it's doing well. You might be fired, accept ni sawa, wamenifuta kazi, what can I do with my hands? You're skilled. Yeah, there must be even that one thing that you can do. Could be music, could be crochet,
and so many other things. We've had people come even on the show, someone who is a chef, and we tell them today, we are not eating anyone else's food, we are eating your food. And they were once fired, but that did not stop them from being who they are. So use what you have to become who you want to become.
Nice. Thank you, thank you. So you can turn your pain into purpose. And so the question for the rest of the panelists, if Purple Parade has one lasting impact on the people listening today, what do you hope that aha moment is for them? Begin with you, Edward.
All right. The one thing that I'll say is that first, we've had a number of children running around here. So that's awesome in the sense that everyone has the opportunity to thrive. You're not your diagnosis, you're not your condition. It's part of the makeup of the person. And so the aha moment that I would say that comes from the Purple Parade is that everyone has the opportunity to thrive, and there are many tools to help you take a handle of the situation beyond yourself as the individual to your support system, your caregivers, as well as your family members. And by extension, the hope is that this will also extend to those who have a large influence on our society, in our lives, i.e. those who are in a position in government or advocacy groups, as well as government, health organs, that there's an opportunity here to help people thrive. So the Purple Parade is something that will help us celebrate the strength of everyone and also allow us to develop our compassion and go further and help everyone with autoimmune conditions to get, to enjoy this pie that is called life. Well, pie, more than a pie. There are many things, but yes, just the enjoyment of life itself. And this extends to their mental health, social interaction, so that is moving away from isolation, and also spiritual as well. Thank you.
Zanel?
I think when I think of the word thrive and basically the Purple Parade, I think of the statement, doing what you can while you can. And I think that's basically the embodiment of how I see joy. I think when it comes to people with lupus, or basically anyone, anywhere, really, sometimes we think of life from a perspective where we're able to do the things that we are not doing now, and that puts us in a shortfall, and we are not able to really see and enjoy the present moment for what it is. And that also kind of generates a bit of regret even before the event has happened. And because we are so future focused, it really puts us in a disadvantage because we're not able to really live the way we are supposed to. And obviously, for those with limited capacity, even so, because we're always thinking, I could have done this or I could have done that if I didn't have this. And so it's really important that moving forward, we just do what we can while we can and imagine that to be the 100% and see how that perspective change shifts a whole dynamic in how we do things and how we move in life. Yeah.
Awesome, awesome. Catherine?
I think
aha moment.
My aha moment is, first of all, the forum for our voices. I think the faces behind the invisible and the visible conditions, and what we need to do and what we need to amplify. Like in any other animal kingdom, you thrive in the environment that suits you. It is us who are going to create the environment we are going to thrive. It's a high time we stand out as warriors, as patients, as caregivers, and especially as warriors. We are not just patients. We are not just recipients of care. We are leaders. We are policy changers. We are the people who guide on what is going to happen. We have the answers unto the healthcare changes. I feel pained, like I think if we gave the doctors who are here time, when a politician is standing here and saying, you know, we've done, we have, I don't know, 500 dialysis units in my country and everything. It is our voice that will tell them, I don't want to get into the situation where I am looking for a dialysis center. I don't want to look into a situation where my lupus has killed my bones. It is us to give that voice and say, there's something you should have done. We need promotive, preventive care. So yes, my aha moment is the voice, the amplifying the voice and the forum, and that we may all go, when you go out of here, I think there's always, we are told that you are the 5 people that you live with. I want to give you a challenge that the voice of the warriors, the voice of our healthcare system is in the 5 people you come in contact with. Say something, talk about it, and you're going to save a life, you're going to make a change.
Asante sana. Dennis?
I think my aha moment is, especially I think I caught this earlier on when you guys went for a walk, and I was like, damn. My aha moment is to say, whatever you're feeling is valid. Whatever you're feeling is valid. Have some compassion to yourself, because nobody knows you as much as you know yourself. Your emotions, your psychological well-being, that's up to you to know that whatever you're feeling is valid and you're feeling it in the moment. So you don't have to offer anybody any explanation, just live your life the way you want to live it. I think this is a journey where people with lupus, people with autoimmune diseases have been able to connect with each other. Nobody, as a practitioner, I can't tell what you're feeling, but a person with lupus knows the kind of charade your life revolves around. There is a lot of things that go emotional, psychological, financial, when it comes to going to the hospitals, the whole shabang. Only a person with lupus knows it. So there is a community here that you can lean upon. There is a community that will teach you to fall in love with yourself. And now that the condition is here with you, fall in love with it, talk to it, tell it, today, tuko na nguvu ya kwenda pale. And when there's no energy to do that, just say, it's okay, let me rest. When I have energy, I'll do that. Fall in love with yourself, develop compassion about yourself. It's more like a time for you to reflect and say, am I able to rediscover who I really am now that this is the future that I'm supposed to be living with? And be comfortable with it. There are times you will be feeling pain, but you will be happy psychologically because you're comfortable with who you are. Okay? So please do take care of yourself. I'm hoping to see more of you guys and to having more engagements such as this. Papa Parade has been the best, man. Thank you, man.
Asante sana. And so that's the end of our panel. I'd like to open the floor to any questions from the audience. Could there be any questions from the audience?
Any questions? Any questions, kindly? Tuko na swali wapi?
Hi, panelists.
Hi.
Yeah, my question goes to the lady who was beyond diagnosis, something like that.
To Esther.
Yeah, Esther. In case I need to come and highlight my story, is it possible to come through you, or which is the channel?
I'm here. See me.
Okay,
even
I
now.
will. I will. Thank
Karibu
you.
sana.
Any other questions or clarifications from the panel? Swali, clarifications. Joy, ni kama tuko na good students.
Nikama. So I'd just like to encourage all the warriors to join a support group community. It's really, really important. So Thrive community, we have 277 members at the moment. I'm sure today we've added a number. And it's in such spaces where you're able to find this kind of support, you know, the social support, the same space you're able to advocate also. If you're not able to like go to SHA, there's somebody else who is able to go to SHA and speak to them about the issues that we are facing. It's in such a forum where we're able to bring together wellness coaches and therapists to come and speak to you, to understand the issues that you're going through. So you don't have to walk this journey alone. There's a lot of support. Even the media today, we have Esther here. You can share your story if you want to share your story. It's really therapy. I've done it before and it was good. It was a good reflection point. So asante sana, our panelists. Oh, Edward. Okay.
Just permit me to get onto my soapbox a little bit. I want to talk about specifically about our young lupus warriors, pediatric lupus warriors who, in certain situations when it comes to schoolwork or exams and things like this, sometimes when you have flares, you might miss class, or your teacher might see what you're experiencing as something that you're coming up with, or tell you that you're trying to get out of doing something at the school itself. I want to ask for grace from our educators to not be fully suspicious. I know it's a very hard, it's a vocation. That's why teaching is a vocation. So to just extend that grace so that if your student misses class, or they're not able to come to the exam, or if they are in a situation where they would like to do this, but you can offer them an opportunity like a virtual situation, please go ahead and do that. If the student shows up with sunglasses and a hat, it's not because they're trying to be cool, they're trying to avoid flares from our great benefactor here, the sun. So yeah, so please, don't be afraid to talk to the child or children and get a fuller picture about that. Thank you. And
So Edward,
yes,
before you drop the mic,
Yeah.
where can people find Lupus Ascending online? Yeah.
We're working on our website, but right now we do have a WhatsApp community. It's I can send to Thrive Community a little poster with a QR code that you can scan, and you can join the community, and we can continue our work from there. Thank you so much to Thrive. Yeah.
Zanel, where can people find you online?
Oh, yeah. Guys, this totally flew by me. But we are on socials, on Instagram at
Benny Boom.
Nafsi Wellness, and we have on TikTok, Nafsi Wellness as well. Oh, yeah, and we usually have wellness workshops once a month. So if you'd like to come, be in tune with nature and play some games and, you know, practice a little mindfulness, hit us up. Yeah.
Awesome. Esther?
We are 3K Media TV on all social media. We have a YouTube channel, as you heard. Please subscribe, follow us on all social media pages. Our contacts are there. We have a website, www.3kmedia.co.ke. You will get to interact with us and get also other services that we offer besides the program behind the diagnosis.
Catherine, are you online?
Yeah, I'm online on my personals, Catherine Mwangi, Catherine Jerry, but I'm all over where a patient needs to talk. You need that patient who will take a microphone and shout, I am there.
Super advocates. Dennis?
Zuri, we have a website, www.zurihealth.com. We also have a QR code. We have WhatsApp groups. We are at Zuri Health on Telegram, TikTok, and also on Instagram. We also have a physical location in Lavington, 132 East Manyani Road. So come visit us. We're looking forward to interacting with you guys. Thank you.
Asanteni sana. Sorry.
We do actually have TikTok as well as IG, social media channels, and a YouTube channel where you can catch up on some virtual sessions we had a couple of years ago covering all aspects. So yes, just look for Lupus Ascending, that's the YouTube channel. Lupus Ascending is the IG account. Sorry about that. Thank you.
Okay, so thank you so much for the panel. I see the sun is out. Hiyo mvua ilikuwa baraka yetu. Yeah. So asanteni sana panel. You are dismissed.
Wapi nduru yao bana watu wangu? Makelele kwa wingi Tupige makofi, tupige miguu, tupige kila kitu tafadhali. Thank you so much. Thank you so much for that informative, engaging session. You know, in my profession in the disability mainstreaming field, there's a particular quote that I do come across very often, and it says, "Nothing for us without us." Sawa? So thank you so much for our warriors for sharing. Thank you so much for the panelists for advocacy messages, and also for creating pathways as far as storytelling is concerned. And that is where Esther Ashira comes in. So thank you so much for that as well. And what about now? Mnakumbuka nikiwaambia tukisema purple tunasema nini?
Parade.
Purple?
Parade.
Purple?
Parade.
Awareness?
Awareness.
Wonderful. Kuna ila amechangamka bwana.
Napenda
hao watu bwana.
Backbenchers usicheze nao. Usicheze na backbenchers wewe. Wausikia.
Wonderful, wonderful. Thank you so much. So, ladies and gentlemen, boys and girls, we are almost coming to the business end of our events today, beautiful events today. But first of all, a few icebreakers hapa na pale. Nataka mchangamke kidogo. Ama namna gani, my friend?
Kabisa.
Ndio. So remember I told you that courtesy of V Squared, wametupatia unlimited internet, ndio? And I did ask a few of us, Mickey.
Yes sir.
Hapo nadhani utabidi umetembea na hiyo mic
ulikinituma natumia.
Tunataka specimen, a few volunteers, a few specimens watuambie.
Alright.
And you will have to confirm.
Yes.
Sawa?
Okay.
Remember I told you earlier that when you come in, you take photos, you get to interact with our vendors, our sponsors, get to share on the socials. Sasa tutajua, mtu msipost sasa itaonyesha seconds and minutes. But Mickey is going to go around. And we do have a few gift hampers for you. Okay, thank you. A few t-shirts courtesy of V Squared. Na hii ni ya kwa wale walicheza kwa mtandao kwanza. Tuanze na hapo. Ama namna gani Mickey?
Very nice.
Sasa tuanze, naona audience session hapo kwa audience hapo.
Ukiona nimebeba red.
Okay.
They are not ready.
So tafadhali, I want you to look out for anyone who posted a photo kwa mtandao.
Okay.
It doesn't matter any platform, whether it's TikTok, whether X, hizo zote.
Yeah.
Anyone who did that, tagged Thrive Community and any of the sponsors.
Okay.
Angalia. If there's anyone in the crowd who did that, kindly inua mkono.
So instructions ni anyone who posted a photo.
Hey, backbenchers.
Backbenchers ndani ya.
Tuanzie tuende nyuma kwanza Mickey.
Backbenchers ndani ya tent.
Ndio hiyo sasa. So kindly if kama kuna mnali post,
acha tuangalie hiyo time kwanza. Time.
Sawa.
Atulisema saa ngapi?
Masaa asubuhi, masaa ya kuamka, masaa tulikuwa tunaingia. Yes.
Atunasema wako wame
post a photo. Tag Thrive Community.
Very nice.
And any of the sponsors that we have here today. We have something for you. I want to kula school fees tafadhali.
Class, yes class.
Class is in session.
Umesema stories ama post?
Nasema kuposti kwenye posti kwenye
umesema post ama stories?
Hapana, kwa post.
Kuna story mtu yangu.
Stories ni hao wote bwana.
Na story huku.
Hapana.
So post.
Kindly Mickey, take a lady and a gentleman hapo.
Okay.
Chaguo ni lako.
Aya. A lady and a gentleman.
Confirm timeline
Lazima mtu yangu. So mna sacrifice nani? Mwingine?
Yes.
Who else? Is there a gentleman here?
Confirm wakati. Confirm ilikuwa picha ya picha safi.
Okay.
Alitag Thrive Community.
Wapi? Huyo amejitag zo.
You know, huyo alikula school fees please. Who are the sponsors? We tagged?
Mtiangu,
yes.
Kuja, njoo tu. Just follow me.
Kuna mwingine hapo, kuna mwingine anakufuata?
Kuna mwingine ananifuata? Who else?
A gentleman please, a gentleman.
Njoo, come. Kuja, usiogope.
Usiogope.
Worry no more.
On the tent piers, on this side of the tent, if
Yes.
if you are sure, you took a photo,
yes sir,
you posted it, tagged Thrive Community, and any of the sponsors hapa. Kuna wale wa uji, kuna wale wa afya,
iko mtu,
kuna wale wa mtandao,
iko mtu mara ya kwanza, iko Joe, come.
Right.
If you posted a photo, you tagged Thrive, you tagged any of our sponsors,
Right.
V Squared, there is Blue Band, there is Renas, any of our sponsors, there is Prayer.
Kindly do come forward.
Kuja. Oh, iko.
Amejamini?
Amejamini. Uko. Kuja Mr. President.
Usijishuku?
Mtukufu rais wacha.
Ndio hiyo.
Wacha mtukufu rais akuje.
Ni kama tunaelewana yeye.
Kabisa kabisa. All right. All right, so kindly, Mickey. Yes, sir.
Confirm for us, yeah?
Let's confirm.
Answer na the ladies. Confirm kama tumefuata instructions.
So the lady has posted a lot of stories, which is amazing things.
Wonderful.
Amazing.
Wonderful.
Wonderful. Wapi makelele. Yay!
That is the kind of advocacy and awareness we want, yeah?
Na ile tent iangaliwe ni nini walikula lunch.
Hiyo tutazungumza. Hiyo we'll have to find out.
Whose choice? It's not even Thrive's choice. All right. So she has posted a lot of stories and she has tagged Thrive, the hashtag.
Apewe a round of applause akipata t-shirt yake basi.
A round of applause.
Apewe t-shirt yake basi.
All right.
Courtesy of V Square.
All right.
Wonderful.
Of none other but.
Waringie waonyeshe ni kala gani waonyeshe.
She's ready.
Hello.
Ready.
Hello.
Ndio hiyo.
Asante sana for your contribution.
We have a gentleman here.
Okay.
Wacha to confirm.
Mimi kwangu nimetag Blue Band kupea uji.
Very nice.
Bado nikatag Thrive.
Okay. Anaitwa nani? Wewe unaitwa nani? Babzigi.
Wapi kelele Babzigi basi pale?
Wapi kelele Babzigi?
Bana. Watu wa tent kuna wivu sana. Tuko na wivu sana.
Unaona wenye waliamka exam?
Hapana.
Sijui shida iko wapi hapa.
Support system. Labda utapigia president kelele yake.
So wazi. Ametag Blue Band, ametag Thrive.
Wonderful.
Wapi makelele ya Babzigi?
Asante sana. Thank you so much.
Very nice.
Thank you so much. Alafu tuko na nani ule?
Tuko na le president. President tuona tubie wananchi. Okay. Aya, hapo ndio, that's the only place umepiga post.
Okay.
Okay.
I'm tag Thrive,
Okay. Aya.
All right.
So Mr. President ameenda mpaka ameshare kwa WhatsApp groups.
Wonderful.
Amego all out.
Yani na tuko outside.
All out na tuko outside. Ameenda huko kote. So
amazing.
Yes, so we're going to also give Mr. President
a round of applause for Mr. President pia pale na yake.
A round of applause for
watu attend sasa ni wakati wenu tafadhali tusikie kelele yenu pia nyinyi. Kabisa.
See. I think this one.
Wonderful.
Let's see whether there is a I think yeah. But it's good.
Iko sawa?
Yes, it's a good. Karibu sana Mr. President. Aya. Iko wapi ingine?
Sasa wacha sasa.
Nimewacha.
Hiyo tumefungia hapo.
All right.
Ndio nimeona ile tent huko mwisho wanaweza kuja wote.
Wale wanaweza ibi wako na exam
nini wako na. Aya, sasa tumebaki na ngapi hapo?
Hapa tumebaki na 3.
Unajua kuna kitu moja pia nilisema bado in line of taking photos tulisema wasemanga piga luku kula wa anjapi.
Ndio hiyo sasa.
Piga luku fanya nini?
Kula wanja.
I know today is all about the purple parade.
Yes sir.
But kuna wale wame outshine. Mimi hapa niko na t-shirt peke yake. Simple ka Simon, sawa?
Yeah.
Lakini we want to look out for who came to dress to impress as far as purple parade is concerned.
Wacha hiyo.
Yes. Kamera ni mingi zimemulika watu.
Yes, tutajua tu msema kweli.
Purple parade.
So tulikuja huku hivi,
yes,
all dressed in purple. We want to find out, of course, we are a democratic organization.
Wonderful.
Who dressed to impress at the purple parade? tunataka
Tunataka
wajitokeze
kuchambua.
hapa.
Na si wenye wamevaa kombato kama wewe.
If you know.
Hapana.
Hautaki jeshi, papolami.
Nyinyi mwele consult.
Aya.
Hiyo ni consultation.
Who feels they dress to impress at the Purple Parade? Please.
Yeah, feel free.
Carry yourself forward.
Confidence. Na ujilete hapa tafadhali. Napenda hiyo. Haya basi.
Contestant number 1 ndio huyu.
Contestant number 1.
Contestant number 1.
Contestant number 1.
Who else feels they dress to impress?
Hello.
Contestant number 2. Hii lazima tupige kura.
How?
Ati music. Nyinyi ile tent tutafunga hiyo tent na. Kuja tu.
Haya basi. Kindly tusome tu hapa.
Who else feels they dress to impress? Kuja upiga luku.
Inakubalika?
Yeah?
Wanasema confidence ni yako mwenyewe from within.
Yeah, na unajua saa watu ndio kusema when hawa ndio voters ndio
kusema. Aya basi yule nani huyo making away?
Voters ndio kusema.
Hello.
Kabisa.
Hello. Aya basi.
So for 2 t-shirts, na mko wangapi?
Unajua? The more the merrier. Lakini tufungie hapo tafadhali, tufungie hapo. Sawa sawa.
Tunataka
wote waamuke.
All right. So Mr. Bill the President.
Yes.
How do you want these votes to
very democratic umesema?
How do you cast these votes?
Hapa ni wanasema ngani ule wenye kuna wengi wape.
Lakini tukisema atuini na sauti wale sauti please wale.
Sasa unajua pia itabidi pia it's an inclusive participation.
Aya, so contestant number 1 please step forward.
Even our sponsors, our vendors wapige nduru, yeah?
All right. So if you feel that Elizabeth Mutuko dressed to impress, wapi nduru wewe? Hata moja. Aya.
Hiyo ni yake. Arudi tu hapo.
Hata yako ujipigi.
Hata
you are not beating your screams. Ujipigi nduru. Aya, contestant number 2 njo. Very nice.
Hello.
Very nice.
Majestically.
You too. Aya. If you feel like Judy dressed to impress for the Purple Parade, wapi nduru wewe?
All right.
Hii imeenda aje?
Kuna decorum.
All right. Aya, Judy wewe simama pia hapo. Aya, come number 3. All right.
Sitambue.
Wewe.
Hello.
Acha nikwambie. Aya. Tata. So, if you feel like Tata dressed to impress for the Purple Parade, wapi nduru wewe? Wait a minute. Okay, umelipana ngapi? Haujalipana? Uko sure? All right. Billy nikatuarudia.
Noma.
Turudie. If you feel like Tata dressed to impress, wapi nduru wewe?
Hapo sasa kuna tashwishi. Unaona hiyo?
Tata wewe kuja hapa. Kuja hapa. Aya
basi.
Contestant number 3. Hapana usijali.
Number 4.
Number 4. Yes. Aya njoo mami.
Ona mambo. Wewe. Hata tujauliza bwana.
Wale wanaiba wale.
Hii ni rigging.
No. Hii kelele lazima ikuwe all round. Hezi toka tuko na moja. Itatokaje na moja? So it has to be an all round, si ndio?
Aya basi.
Aya. Sawa. So, if you feel like mom here came for the Purple Parade and she really dressed to impress, wapi nduru yake wewe?
Hii mpaka DJ ameingilia.
Aya. Mama sasa wewe enda pale.
Ini from 34. Right. From 34 was ginene.
Aya, last but not least.
Yes.
Comes now. Wewe.
Ogopa.
Sawa. Tuko sawa?
Huyu ametuambia. Ametuambia hiyo papo ni yenu.
Walai.
Wewe umeona amesema hiyo papo.
Papo ni
yeye amedress to impress.
Papo ni perspective. Perspective.
Wonderful.
Kwake ni purpose.
But kama amedress to impress atapewa yake au sio?
Sawa.
Twende.
Sawa, ladies and gentlemen, right about now, If you feel Zanel dressed to impress for the Purple Parade, make some noise! DJ. Huyu ako na kura moja ya DJ peke yake.
Umeona hiyo?
Na yake mbili. Sasa hapa kuna so Zanel ena pale. Njoo. So hapa hivi mwezi achiliwe hivyo. Nyinyi tutawaachilia na baraka za Mungu. Msijali. Nyinyi kitu tuko nao ni blessings. Njoo Tata na Judy. So sio mimi ni
si wewe.
Sio mimi.
Sikupenda kwako.
Nikupenda kwangu?
No.
Is it my loving? It's not my loving, si ndio? It's not my loving. Sawa. So Savas tumefunga sasa na tumehesabu kura zote, and according to the votes casted.
Yes.
Casted and votes returned. Yes. So our returning officer, which is all of you, has successfully made some loud noise and noises. Elected. Actually, we only have these 2 t-shirts. But hatujasema nyinyi mmeshindwa, by the way. Nyinyi ile luku mmepiga nyinyi. Sawa.
Sasa wameshinda poa.
Wameshinda hapa.
Wameshinda.
So we have Judy and we have Tata who wamekuwa na the most noise. Sindio tuko sawa?
Itabidi tuwapatia saa ile ya kufunika sasa. Okay.
This is yours, courtesy of V
Square. Wapewe makofi tafadhali. A round of applause.
Yes, courtesy of V Square. Yes.
Thank you so much V Square.
Thank you so much V Square for the beautiful t-shirts. Na isi ya kulala hii unapiga luku nayo unatembea nayo tao. Usilale nayo hii. Don't sleep with this. Sindio? So thank you so much. Sasa hawa wapatie ngoma DJ. Hawa kitu tunawatuma
kufanya mambo sasa.
Ngoma.
Ya ni sawa, rusha tu kidogo hapo tuwape doba. Tuwape doba, si ndio? Haya basi.
Down without a fight, right? Yes, they fight, they do all whatever they can to just take the next breath, okay? So last year, I think from October actually, October to all the way to December, we lost, I think, more than 18 warriors, within a span of 3 months. 18, actually 20 Lupus warriors within a span of 3 months. That's not to discourage you guys. Yes, they fought. They did all they had to do. And now what of course has been left of us, the Lupus community, is fight and continue fighting and continue fighting. Sindio? Yes, and so we want to do something here, as it is always our tradition.
Yes.
We want to commemorate. Is it commemorate?
To honor. Commemorate.
So commemorate.
Yeah.
Yes, we want to honor those who have gone before us. And we just want to, of course, remember their names, remember the role that they've played in our lives. Some encouraged the warriors. Some have been a pillar of strength, and we want to honor them this evening. So we're doing a candle lighting for all the warriors who have gone before us, not who have left us. They have transitioned and they've gone before us. And I'd like each and every one of you to just come. This is this space.
Yes.
We want to use this whole space. Just come. We want to light some candles in honor of the warriors who have gone before us. Yes. So kindly.
I would kindly, sisi wote,
yes,
even including our partners. Kindly let's make way.
Yes. Just be up on your feet. Let's come. Let's use this space here.
It is a reflective moment that we should have, yeah?
Yes. Yes, kindly. Even those probably when you're pale kwa tent, if you don't have a role there, just come, let's make a circle, a big circle like what? Sufuria is never big. Yes. Ile madanga, maharusi. Yes. Yes, they are actually apo iko sawa. Then you can just make a big circle. So the vendors probably who are warriors come, and if you don't have anything you're doing there, just come join us for this special moment.
Come close, msiogope.
Yes, msiogope. Just we're making a circle.
Remember, we are a community, yeah?
Yes, it's a community. Is it a two-thing? All right, so let's come, and basically a candle is a symbol of the light will never go off, right? Yes, and we are the light that were left here, and we need to continue fighting. Just there they would have loved to. Yes. Santa Sana.
As well. Usiachwe nyuma, usibaki nyuma tafadhali. Let's join the whole procession. Our partners, if you're not fully preoccupied as well,
yeah, you can join us.
You can join us here. We want to say a massive thank you to each and everyone who is here, but also remember those who have gone ahead of us. Wonderful, wonderful. Thank you so much. Asanteni sana. Usikose kuwa na lako.
Yeah.
If you don't have a candle, kindly just raise your hand. Utakufikia. Tuone.
Yeah.
I like to be educated, but I'm so frustrated. Hello to my loneliness. I guess that ignorance is bliss. Take me back to before I knew. Rewind, take it out of cue. Innocence can be a young man's game. Signed up for the hall of shame. I wish I knew how much I miss. other way. Sun is out, but the sky is gray. What would happen if I took a chance? It's always hard at first glance. I don't wanna, but I know.
until the time that God calls us home. God bless you so much.
It's been real. Purple Parade 2026 has been real and has been successful because of each and every one of you. Thank you so much. And long live the warriors! Thank you so much, Tasha.
Hi, guys. Thank you so much. My name is Natasha Muloko, and I'm the proud co-founder of Thrive Community. I'm also a lupus nephritis warrior. I've been a lupus warrior for 18 years, 19 years. I was just telling someone I've lived longer as a warrior than not being a warrior. So I'm proud of that. And I'm also a dialysis patient. I've been dialyzing for 12 years, and I'm also proud of that. And I'm here to give a vote of thanks. First and foremost, I'd like to call Loxy Events. Loxy Events will represent all the donors, sponsors. She believed in our dream from last year. She's been there for us. She's the one who does the decor. She's the one who does the photo booth. And she does it on volunteer. So I want her to represent all the donors, the partners. And it's also her birthday. Yeah, she postponed her birthday for me. And she'll celebrate it next weekend so that I can have this day. So that's why I'm giving her the flower. Yeah. So Loxy Events, thank you so much. Mickey, please do the honors. On behalf of Thrive. Yeah, thank you so much, Loxy, and may God continue blessing you. Happy birthday. You, happy birthday to you. Happy birthday, dear Loxy. Happy birthday to you. Thank you so much. The next warrior is Kagwira. Kags. Where is she? Kags. Kags has done the most, like this year, she has conquered one of the things that most of us warriors always want to achieve. Kags is the mother of a beautiful baby girl. Yes, so we said we'll call her baby Thrive Baby because, yeah, and she's also part of the steering committee. So she's going to represent all the warriors. We'll have a flower for you, Kags, to represent all the warriors. Thank you for inspiring us. You've given us so much hope, and we pray for you, and what you did was courageous. It was courageous. Please, Joy, give her officially. Akipanguza machozi. Yeah, because she's conquered so much. Having a child and being a lupus warrior is not easy, guys. This is courage. This is courage. Mi sina hiyo courage. Mi niliogopa. Hiyo mambo nilisema tu nili-accept. That was courage. Kags, we are proud of you. We love you. And we wish you all the best. Yeah. Makofi tafadhali. Yeah, so she's representing all the warriors. So last but not least, I'm going to call my mom, Caroline Manka, to represent all the caregivers. Without our caregivers, our family, our friends, we would not be here today. And Mami, I love you so much. You're my biggest warrior. Without my mom, you guys will not be, we will not be here. Let me not lie to you, because she feeds me strength, she fills my cup, and she allows me to fight this disease. She allows me to give you the support that I can give you. Yeah? She tells me, I'll cater for everything else. So I'm proud to be her daughter, and I thank God every day for her, that she came into my life. Mommy, I love you. Thank you so much. May God continue blessing you and continue blessing the work of your hands. Please receive these flowers. Love you. And happy Mother's Day. This is the first Mother's Day I get to celebrate with my mother, because she lives in Tanzania. I live in Kenya. Yeah, so this is also a special day. So I want to thank everyone here, guys. Without you guys, we would not have made this possible. Yeah, so thank you so much. May God open up doors for you. Any door that you go knock, please, may God please listen to us. Please open for them the doors. Help them create awareness. Thank you for helping us create awareness. Share our page, follow our page. And yeah, thank you for believing in us, believing in our dream. Every month we have a hangout at Bomb Blast. We'll be announcing in our pages. We hang out the first Saturdays of the month, every month. Then in December, we have Purple Circle. That one is just fun. No speeches, no, it's just having fun, games, networking, and just getting to know each other. It's called Purple Circle Hangout. Yeah, so thank you so much. See you in Purple Circle. See you next year in Purple Parade. You're a blessing. I love you guys. And yeah, that's all I can say.
Yeah, give it up for Tashi. Yes, so right about now, as we go to cut the cake, I want to acknowledge and recognize actually our partners, our sponsors, starting from actually I think this tent here. This tent here we have. So when I mention their name, just give them a shout. Sawa sawa. So we have, give it up for 3K Media. Yes, 3K Media are the ones that have made sure that we are online there. We have reached, we have gone to nations. Amen. Thank you so much. Courtesy of Ashira there. Thank you so much. Thank you so much. Aya, give it up for Nairobi Chapel with the sound. Yay. Sawa sawa. So Nairobi Chapel tunashukuru sana. And give it up for the one and only DJ Bonnie. Yani DJ tu unajeke hiyo kitu. Onge tu wewe wacha. DJ square hivyo. So DJ Benny Boom ndiye amekuwa on the ones and twos hapa hivi akichuna zile vitu. Thank you so much. Na yeye pia atatuchezea mambo tukimaliza. Sawa. Aya, on that tent when you make sure that everyone here amekuwa akistream, amekuwa Instagram and chill and all that. So give it up for V Square Network. Amen. Thank you so much. On the yellow tent, on the yellow corner, we have amazing people that have ensured that to make uji ya peanut. How do you even take peanut porridge? How do you even do that? But they have done their magic. And give it up for, should you say Blueband or Skyward? Blueband. See, you know tunajua. Give it up for Blueband! Yes. Of course, with their team leader and
Yes. Kidogo tu.
Yes, sir.
Naambiwa kuna uji ya kila mtu.
Kuna uji ya kila mtu? All right.
So nyeti,
kuna
so nyeti.
Ni uji ama uji. Unajua, be specific. Kuna uji ama uji. Uji?
Yeah, tafadhali.
Uji for porridge.
Yes, please.
All right, thank you. Aya, sasa. On the other tent, we have, there's a house there that is called Rena's House that are making very amazing and sumptuous cakes. And give it up for Rena House. Yes. Ndio wanafanya mambo yao pale. Yes, so mumpatie kazi, si ndio? Aya, we have our table tents there. We had Soyan. Give it up for Soyan. Ito Soyan Empire. Hiyo luku ni yake, luku baridi. Hii luku ni yeye ametengeneza mtu yangu. Na she's buying Kenya and wearing herself. Sawa. So thank you so much, Soyan. She's a warrior. She's going against all odds and making all those beautiful sweaters. So thank you so much, Soyan. So we have someone called Ekai Crafts. Give it up for Ekai Crafts. Thank you so much. Karasi of Tracy Gadoni anafanya mambo yake pale. Yes, so mkimaliza mnapitia hapo hivyo. So we have another warrior who has prepared a book, who has written a book. A bakery book, right? Yes. Give it up for Dorcas, bwana. Yes, and then we have Savi something. Where is Santa Claus? Savi what? Mr. Savi. Mr. Tech, Savi Tech. All right, sawa. When do Mr. Savi Tech ama? Sio wewe. So thank you. So give it up for Mr. Savitech for their beautiful watches and smartwatch and all that. Thank you so much. So we also have Jaribu Ben Wamenda. Try Ben Wakwapi. Okwapa. Oh, Try Ben is also here. So they are giving home care services and trainings and all that. So give it up for Try Ben services. All right. We also have Kasarani. Actually, Kasarani Maternity ni wale tu tunaoendea. Leo siku tunaambia tuko na event kesho tunataka sponsor. And they say, kwani si udu? Si wana kitu si udu. So give it up for Kasarani Maternity. They always come through for us. Thank you so much. Who else? We have another one who is called Equity Afia. Equity Afia also, they were in the Purple Parade season 1. They are also here in season 2. We are really, really grateful, Equity Afia. So give it up for Equity Afia. DJ Tukodio Kitu. Thank you so much. Who else have I left? Tuko pale kwa prayer mani prior. So prior to the event, we had prayer. Prior to the event. So we have prayer who are doing, who has ensured that they are recycling environment. We are leaving our environment as clean as we found it. And ikona one gentleman called who? Wallace. So thank you so much, Wallace. You're doing an amazing job. Give it up for prayer. Yes, I want to pick up my glass pal, and then you're wondering how did they even do this? Lakini kila mtu na profession yake, si ndio? Thank you so much, prayer. Tuko na mdemu mwingine hapo hivyo anaitwa Wangesh. Wangesh ako na urembo fulani pale hivyo. Ako wapi? Mbona upigi nduri yako? Walai, can cheat. So thank you, Wangeshi. Wangeshi is doing an amazing job pale hivyo na to earrings, to bracelets, right? Amana nasema vitu zangu. Sio jaba. Oh, so thank you so much, Wangeshi. And we have people who have ensured that our stomachs are not empty. So give it up for Farmer's Choice. Yes, Farmer's Choice. Thank you so much for ensuring that wengine wetu tumewakula vitu zenye hatujai kula yani tumezipata tu hapa leo, but we are grateful. Thank you so much. Next to Farmer's Choice, we have, these people, they just went all out. Walisema, the bus will not be enough. We need an extra tent. And they have done an amazing job. And Zuri, nyini wa Zuri. Zuri, nyini wa Zuri tu. Zuri. We are really grateful. And yes, you've had their panelists. Cynthia was there. Who else? Dennis was there. And they wakona info. Cindy wakona info ingine is going to help us in our daily living as far as our health is concerned. Cindy, give it up for Zuri Health. And also we have Nafsi yangu iko wapi? Nafsi ame? Nafsi baidha iko personal. Yani Nafsi tulisema moja hapa hapo lukaenda. Ako wapi? Haiko personal. But give it up for Nafsi Wellness. Thank you so much. And we have our amazing doctors who have ensured that, lazima mwene na hii kitu mnapataga kwa consultation room, tukuje tuipatiane hapa hivi. So we want to start with Dr. Wairimo. I think she's here. She's here. I've seen her somewhere. Yes, give it up for Dr. Wairimo. Thank you so much. And we have Dr. Eugene in absentia. Doctor, so what? So Kwala. Wait, Wakigu so Kwara, ni so Kwala. So Kwala in absentia. Give it up for Dr. So Kwala. Nani nimesahau? Oh, Mimi, yeah? Oh, give it up for Dr. Cynthia Moihaki. Nani nimesahau? Daktari mgani nimesahau? Bill Weso daktari wacha wewe. Ati? Dennis. Oh, give it up for Dr. Dennis! Thank you so much. I think that's it. So we are really, really grateful. You have made the Purple Parade 2026 a success. May God bless you all.
Thank you.
May God increase you all.
Amen.
May your boundaries expand.
Yeah.
And kama hujatoka hapa hivi na mtu wewe uko na kasoro. But tunashukuru sana. So God bless you so much. Over to you, who? Tashi.
So can I have all, if you're a diagnosed warrior, lupus warrior, please come to the to the front. We cut the cake. Tafadhali, time is not on our side. Imvo inataka kukam. So if you're a warrior, please come. Nisiwaite jina.
Selector.
Na wajua jina. Please, warriors, tuchangamke, waoneshe mko na nguvu. You are not your disease. DJ, weke ngoma wakikuja. Catherine, umesahau diagnosis yako? Ama umeponeshwa kwa tent ya Nairobi Chapel? Yes, all our beautiful warriors, here they are. It's an invisible disease. You can never know. Please, warriors, mameni hapo nyuma. Pandeni hapo line. So, DJ, tuweke kangoma. Wekezo na kuje mpige picha. This cake was donated by
Elsie's Bakery.
Yeah. By the way, parade ni donations. We rely on donations. So thank you so much, LT Cakes, if you're watching. Thank you so much, those online watching. May God bless you. Shikeni kiss.
In hospital corridors and under bright lab lights, countless tests are run, yet answers remain out of reach. For many patients, the search for a diagnosis is a journey filled with uncertainty, pain, and hope. Hi, I am Esther Ashira, and welcome to Behind the Diagnosis. This is a show where we listen, we learn, and we shine a light on the real stories of people living with rare and autoimmune conditions. This is a safe space for patients, families, and anyone seeking to understand what it truly means to live with these invisible battles. Every week, we'll hear powerful stories, meet specialists who help us make sense of the medical journey, and most importantly, we'll remind each other that no one is alone.
So, the first thing you have to notice about you won't get anywhere with that patient.
If you have vitiligo, usikose kutumia sunscreen, it will help you.
You feel like you're not being productive. You don't have a purpose. Because even doing things at home, there are times I can't wash dishes or cook.
So I tell them in a few years' time, okay, when you eventually all die at some point, what do you want to be known for? Are you the victim or the victim?
When it became worse, like paracetamol could not just cool it down, so I would end up in the hospital. And if you remember, it was the COVID season.
There are times my children are talking to me and I'm feeling,
Don't forget to subscribe, like, and share, and also follow us on all our social media pages so that together we can raise awareness and give hope to those who need it most. Behind the Diagnosis, every story